Ang unang kinatatakot namin para sa mga anak ko ay yung paano ko sila bubuhayin, paano ko ulit sila mapapag-aral, mabibigyan ng magandang kinabukasan sa buhay nila. Para sa akin, ang isang responsible mining is yung talaga sila yung tumitingin sa anong pangangailangan ng komunidad. Ginagampanan nila anong nasa ayon sa batas na kailangan nilang gawin. At yun talaga yung una, yung social services na ibinabahagi nila at ipinamimigay sa mga tao sa community.
Binibigay yan lahat ng libre sa pagtatanim ng agar-agar ng HMC. Pan-export daw to. Pero yung position nito, ibibilad mo muna, kabilad nito, babanlawan mo ng tubig hanggat siya matanggal yung asin niya. Pakukuluan na to ng tubig hanggat lumapot siya. Pag lumapot na siya, lalagyan siya na ng mga ingredient. Tapos, pwede na siya kainin.
Kami po ay natutuwa at andito kayo uli ngayon. For some of you have attended our past training programs kahit sa aling organisasyon, mapa UPCM, CMC Foundation man or sa PPI or sa NUJP, sa PCIJ, etc. mga pareho po kami mga partners in some other ways. Pero ngayon po ay ginagawa namin ito sa pagtutulungan ng Philippine Press Institute at saka ng Philippine Social Science Council. At kami po ay natutuwa uli dahil andito po ay ang partner na, generous partner namin, ang Nickel Asia Corporation. I was just talking, having a chit-chat with its Vice President for Corporate Communications. At ito po ay in collaboration with the University of the Philippines, Diliman, University of the Philippines College of Mass Communication, University of the Philippines College of Public Health, and Commission on Higher Education. Bago po tayo magsimula sa ating programa, may we have a moment of silence please, as we pray. Almighty Father, we thank you for giving us this opportunity to gather again in your name. We thank you for all the blessings, for your compassion, for your grace amid this raging pandemic. Lord, we pray for our health. We pray for the health of our partners, for our loved ones, our families, friends, neighbors, collaborators, acquaintances, workmates, at marami pang ibang taong nakakasalamuhan namin sa araw-araw. Kami po ay nananalangin, Lord Jesus Christ, na kami po ay maging healthy para po magampanan pa namin yung aming trabaho, aming responsibilidad sa lipunan. This we ask through Christ our Lord. Amen. 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 Bukas po natin ating mga cameras muna for a while. Let's turn on our videos and cameras for a while for our first photo op this afternoon. And strike a pose, please. As I always say, wear those beautiful smiles. Okay? Kahit mainit yung panahon. 1, in 3, 2, 1. Here, are you ready?
Ready? 1,
1, 2, 3.
Okay, please on your cameras.
Thanks, Care. Thanks our training team. Maraming salamat ulit sa lahat ng bumubuo ng ating programa ngayong hapon na to. As I said, from the last time we saw some of you, sabi namin, we look forward to meeting you again. And here goes another training program brought to you by the UPCMCFI Foundation, supported by Nickel Asia Corporation at ang ating mga collaborators po or partners natin, Philippine Press Institute at Philippine Social Science Council, as our partners, and our collaborators again are University of the Philippines, Diliman, University of the Philippines College of Mass Communication, University of the Philippines College of Public Affairs, and the Commission on Higher Education. To welcome us all is a tenured faculty member at the College of Mass Communication, University of the Philippines in Diliman, where she is the current dean. She is also an affiliate faculty member with the Faculty of Information and Communication Studies, serving in the Doctor of Communication program of the University of the Philippines Open University. She is also the head of the production of TV UP, the internet television station of the University of the Philippines System. Please welcome Professor Arminda V. Santiago, Dean of the College of Mass Communication. Magandang hapon sa iyo, Dean Army.
Hi, Sir Ariel. Magandang hapon.
Kumusta na po kayo? Alam ko
magandang nagkikita tayo kahit na virtually.
Oo nga.
So, sana matapos ang pandemya para na napipisil-pisil ko ang
correct.
Diba?
Ang aking matambok na pisngi.
True.
Maraming salamat, Dean. I'll give you the virtual floor to you, please. Welcome to this seminar as you welcome all of us.
Okay, thank you very much. Isang mapagpalayang araw sa ating lahat. A pleasant. The COVID-19 pandemic is a far-reaching health crisis affecting not only the Philippines but the world. And its origination is reported to be from Wuhan, China in November 2019. However, it has spread, and then later the WHO has declared it as a pandemic on March 11, 2020. You may recall that the pandemic came to our country at a time that's still reeling and literally on the steps to recovery from natural disasters like the Taal volcano eruption. Who can ever forget that? Typhoon Tisoy and the Davao del Sur earthquake. Essentially, the pandemic has resulted in a degree of economic paralysis and the immobilization of social and community life due to the imposition of stay-at-home restrictions and other laws and LGU ordinances to be able to control how people move, how they behave, and how it responds to the so-called new normal or a new reality. In this new reality, every person has to adjust and to live with communicating about health, and it becomes salient to us for so many reasons. And essentially, we have to know, actually, as individuals, that how do we define a pandemic or this word pandemic, or how can we describe the disease that we are confronted with, or the virus that causes the disease, how it is transmitted, how dangerous it is, what measures should people observe to avoid getting infected, why the health measures need to be done by each and every person, just to mention a few. And then many times there is misinformation and disinformation, sadly, that happens along the way. So alongside these concerns is generating the data on the disease, such as how many have been infected, how many deaths, and how many have recovered from the disease. Actually, I recall when I was invited as a keynote speaker for a conference in Malaysia quite recently, I learned from them that in Malaysia, they do not report how many have recovered. It's only how many cases and how many have died. Okay? But then they were asking me about it, why we have to report how many have recovered. And I said that in a way, it makes us at ease that we know that there are people who recover. Many experts are called into the picture, okay, such as epidemiologists, mathematicians, experts on infectious disease, public health experts, disaster management and mitigation experts, economic analysts, and even the members of the military and the police. However, with science, medical information being specialized and the jargon-laden field, the information has to be translated to a language that can be easily understood. And this is why we are here. This webinar aims to fulfill the intersection of science, health education standards, and society's understanding of COVID-19 and other infectious diseases. This is what we conceptualized this webinar. We have organized this to generate awareness and information on how populations behave or respond to a pandemic using statistical data as basis for action. Many times we have to refine our understanding of the outbreak of a disease and how COVID-19 and other infectious diseases spread, and also to identify ways on how organized information on COVID-19 and other infectious diseases may be promoted to the public. We have invited 3 experts in the arenas of health communication and health literacy. So that we have our expert on health communication, we have our experts on health promotion and development in the time of COVID-19, expert on health reporting in the time of the pandemic. They will navigate us through understanding this pandemic and COVID-19. Let us have an enjoyable and productive session this afternoon with our experts. We also highly encourage you to echo to your family, to your friends, colleagues, co-workers, and community our learnings for today. Welcome to the Health Information Literacy webinar organized for you by the UP College of Mass Communication Foundation in collaboration with the Philippine Press Institute, the Philippine Social Science Council, and supported by Nickel Asia Corporation, and also with the support of the University of the Philippines System, University of the Philippines College of Mass Communication, and University of the Philippines, Manila. So thank you very much, and please let us have this learning session started.
Yeah. Maraming salamat din, Arm, and thank you for setting the tone of this webinar this afternoon. I was telling, some people nga, in another form, I think we need to normalize conversations on health ngayong pandemic na to. Not because it's a pandemic, I think it's a good opportunity for us to really to keep talking and to keep on discussing among ourselves ang importanteng bagay about health. Kaya ginagawa natin itong seminar na ito, ang webinar na ito para mag-promote ng media and information literacy about health. And I think for the most part of it, we want people to take good care of their health. Diba? Yun naman yung Dean Army, ang pinakapulot dulo ng ating pag-uusap ngayon. At speaking of pag-uusap, masarap po kausap ang ating susunod na magbibigay ng kanyang message. We were just talking kaninang bago mag-start ang ating programa. Always a good opportunity to have them. And also, we thank so much. We couldn't thank enough Nickel Asia Corporation for really supporting these kinds of activities na hindi lang makakatulong sa ating publiko, pero I think for the most part of it ay makakatulong sa bansa. Siya po ay kilalang manunulat or columnist ng Malaya. He's also a public affairs commentator. As I said, he is the Vice President of Corporate Communications, Nickel Asia Corporation, at a proud, tama Sir JB, proud COVID-19 survivor. At salamat sa Diyos, magaling na po si Sir JB Bailon. Please welcome Jose Bayani, JB Bailon. Magandang hapon, Sir JB.
Good afternoon,
Good
Sir Ariel. Congratulations ulit sa PPI at saka sa Mascom Foundation for this webinar, and to all the partners. As I said, I would rather not switch on my camera so that my good looks don't interfere with what I have to say. Pero tama ka, Ariel, no? A few, 2 months ago, I did not think I would be here to deliver this remark. So it would have been Lester Pasqua, no? If I had succumbed to COVID, no? Since I was COVID critical. And therefore, I was very, this opportunity is very special to me. No? It's very personal to me, no? Because I believe this is a great opportunity for our experts to share 3 very important, I think, items with the general public. No? The first is, how do you get something like COVID-19? I think this is something which many people still don't get. No? And to me, my own experiences made me realize that the greatest danger to all of us are in close quarters where we drop our guards. No? Because I suspect I got my COVID when I was having dinner in the condo of a friend who had flu-like symptoms but had tested negative for COVID using a rapid test. And we all know that a rapid test is not the golden standard for COVID testing. No, he had moderate symptoms, and we both suspect later on that it was COVID. Except that in my case, it deteriorated and I had to be admitted to St. Luke's as a critical patient a few weeks later. So how do you get it? Then how do you spread it? No? And again, the value of wearing masks cannot be stressed enough, because sabi nga nila, it's in droplets, and you do this by talking, coughing, laughing, and breathing. And finally, how can you be protected? Especially on this last aspect, I hope I'm looking forward to the 3 speakers highlighting the importance of vaccination. There's a lot of lack of information, there is misinformation, and there is also disinformation. No, may mga nagsasabing ayaw nila magpabakuna dahil daw magkaka-microchip yung kanilang sistema, no? At magiging pabor sila sa West Philippine Sea sa 9-dash line kung sila ay kumuha ng Sinovac. No? Our brand's important. How long does a vaccine last? And after the vaccine no longer has its efficacy, what next? So this is a great webinar, and again, Nickel Asia is proud to support. Mabuti na lang na hindi ito pre-COVID days, kung hindi baka nagka-stampede line like Wawa Willy dahil sa dami ng gusto sumali sa ganitong webinar.
True.
Napansin ko 134 ng participants online. And so doon sa mga makikinig na ordinaryong mamamayan, please take note, because I believe what you might hear today might save your life or the lives of your loved ones.
True.
And I hope that both PTI and the College of Mass Communications Foundation can do more of this. And as usual, Nickel Asia will be here to support you. Mabuhay kayong lahat.
Maraming salamat, Sir JB. Ako po ay natutuwa dahil lessons learned from his own experience, at malaking bagay na kapag-usap tayo ng ganito, especially sa mga taong naka-experience ng ganitong sitwasyon, ng ganitong condition. But of course, hindi naman kailangan makapag-usap natin sa merong ganong sakit para para matuto dahil delikado din naman. But I think hearing from one person who really survived it all gives us a knowledge about what's going on, realities on the ground. And having said that, we're so thankful that another person is going to give a message to us. Also, congratulated the partners, the organizers, and the collaborators for coming up with a significant discourse on health information literacy. Okay, he currently holds the position of chairperson of the Commission on Higher Education, or CHED, advisor of the Philippine negotiating panel with the National Democratic Front / Communist Party of the Philippines, New People's Army, and commissioner of United Nations Educational, Scientific, and Cultural Organization, or UNESCO. He is a professor of public administration at the University of the Philippines and served as its vice president for public affairs from 2011 to 2016. He is an academician who has used his technical expertise to help policymakers educate the public and run political campaigns. His areas of policy expertise cover higher education, agriculture, indigenous communities, environment and climate change, good governance, and local governments. He has spent the past 3 decades in the policy arena in the Philippines and the United States. He served as executive assistant, chief of staff, senior consultant, and senior advisor to Senate Presidents Aquilino Pimentel Jr., Coco Pimentel, Senate Presidents pro tempore Sotero Laurel, Leticia Ramos Shahani, and Juan Clavier, and Senators Gregorio Honasan and Ramon Magsaysay Jr. from the 8th to 6th Congress. He is an internationally recognized political analyst and opinion maker whose views are extensively quoted by foreign and local media. As a public intellectual, he simplifies complex studies and explains national issues through his top-rating education program, Turo Turo, in DZMM Teleradio by ABS-CBN, and No Filter on ABS-CBN News Channel, or ANC. Unfortunately, we will not be able to make it today. Please welcome, as I read the message of Dr. J. Prospero Popoy Idevera III, DPA Chairperson of the Commission on Higher Education. He says, on behalf of the Commission on Higher Education, I would like to congratulate the UP College of Mass Communication Foundation Incorporated for conducting the second in a series of online seminars for 2020 on media and information literacy with the theme Health Information Literacy 2021. I commend the UPCMCFI together with the Philippine Press Institute and the Philippine Social Science Council for conducting the event in order to share knowledge and experiences in promoting health and to facilitate collaboration that will promote an exchange of research findings in specific areas of concern. Research plays an important role in society because it generates new knowledge. In particular, health research can provide important information about disease trends and risk factors, outcomes of treatment or public health interventions, functional abilities, patterns of care, healthcare costs and use, and a lot more. We at the Commission support the efforts of higher education institutions all over the country in implementing initiatives that promote partnership, cooperation, and integration. We are certain that our higher education institutions would realize and maximize their potential in serving the nation, focusing on advancing human development and thus achieving heightened economic progress. I encourage the participants as well as the administrators, faculty, and students, number one, to make research and innovation integral to the organization's health research agenda. Number two, to analyze and address the trends and underlying issues in a coherent way to improve the chances of sustainable long-term progress and spearhead revolutionizing initiatives in the growing field of sustainability. And number three, to proactively continue to enlighten the youth to help generate further and wider public support for health-related programs, especially those programs which may help to battle COVID-19. I wish you all a productive conference. May this event open wide-ranging discussions where ideas and trends on healthcare and related fields co-create a sustainable future for all of us. Congratulations and mabuhay. Signed, Dr. J. Prosper Idevera III, DPA, Chairman of the Commission on Higher Education. Maraming salamat po, Dr. Popoy, for this wonderful message. Inspires us more and motivates us more to do better. Thank you very much. And to proceed with our program, let us listen to the overview of this entire activity this afternoon. She's going to be given by the Executive Director of the UP College of Mass Communication Foundation Incorporated, Maria Isabel Risa Silvestre. Hi, Risa. Good
Hi,
afternoon.
Ariel. Good afternoon.
How are you? Good afternoon.
I'm good.
Please.
I'm good. Yeah.
Very
Thank
good
you.
to hear. Yeah.
Okay.
Yours, please. The floor is yours.
Thank you. UP Vice President for Public Affairs and Chairman of the UP College of Mass Communication Foundation, Dr. Elena Pernia, Dean, UP College of Mass and President, UP College of Mass Communication Foundation, Dr. Arminda Santiago, Executive Director, Philippine Press Institute, Ariel Sebelino, Executive Director, Philippine Social Science Council, Dr. Lourdes Portus, Vice President, Nickel Asia, Mr. Jose Bayani Bailon, distinguished speakers and guests, good afternoon. Welcome to today's webinar on Media Information Literacy with the theme Health Information Literacy. This is the second of a series of training program organized by the UP College of Mass Communication Foundation with the support of Nickel Asia, Commission on Higher Education, Philippine Social Science Council, UP College of Public Health, and the Philippine Press Institute. Before I proceed to the overview of today's forum, may I introduce to you the UP College of Mass Communication Foundation. It is a non-stock, non-profit domestic foundation established to collaborate with the UP College of Mass Communication. It exists to provide continuing training, coaching, and mentoring to mass communication educators and practitioners in coordination primarily with the UPCMC. It also undertakes projects having the UP College of Masscom and the communication and media education community, both local and regional, as its primary beneficiaries. Now for today's webinar, we have the following objectives. At the end of the webinar, participants would be able to acquire knowledge and understanding of health information literacy, particularly in relation to the pandemic. They'll be able to identify health myths and disinformation, as well as strategies and techniques on how the participants may become health literate. To enable the participants to process and communicate COVID-19 related information to their audience and develop health messages or health communication plan. To achieve our objectives, we will be joined by distinguished speakers. So we have Vice President for Public Affairs, Dr. Elena Pernia. She will be discussing on setting the framework for health communication and health literacy. Then we have Assistant Professor Benalyn Teresita Mortel, UP College of Public Health, for health promotion and development in the time of COVID-19. Last but not the least is Ms. Diana Mendoza, Associate Producer and Head Writer at One News Signal TV Philippines. She will lecture on health reporting in the time of pandemic. So right after the presentation of our speakers, we will be having an open forum. So please prepare your questions, which will be read by our moderator, the PPI Executive Director, Ariel Sebelino, as these are given in the chat box here in our meeting room and also in the comment section of the FB pages of the Philippine Press Institute, the Philippine Social Science Council, and the UP College of Masscom Foundation Incorporated. We are also on FB Live. So with that, may I now hand this over to our moderator, Ariel.
Thanks, Risa, for giving us the overview. Keep safe, please. Maraming salamat uli sa pagbibigay ng orientasyon on the entire program. Okay, let's get on to our program proper. I'm pretty sure that all of you are ready to hear from our resource persons and experts. Ang una po nating session is going to be about setting the framework for health communication and health literacy. including findings and study in COVID vaccination. But before that, let me just remind everyone that the evaluation form will be posted on the chat room. Please accomplish it later at the end of the session so that you can get your certificates. Okay. She is a distinguished expert in communication and media education, research, planning, and program evaluation. She focuses on building the capacity of students, government institutions, and civil society organizations to design, implement, and evaluate their own communication programs. She is currently a professor of communication and vice president for public affairs of the University of the Philippines in Diliman. She also sits on the executive board of the Philippine Center for Communication Programs, or PCCP, the Pi Gamma Mu International Honor Society, and the Philippine Alpha Center. She has previously served on the boards of Division of the National Research Council of the Philippines, or NRCP, the Singapore-based Asian Journal of Communication, and the International Communications Association, or ICA. Please welcome the Vice President of the UP Office of the Vice President for Public Affairs. Please welcome Dr. Elena Neni E. Pernia. Hi, ma'am.
Hi, Ariel.
Hello. Good to hear from you again and to see you again.
Oh,
Albeit
thank you very much. Kaya nga, sana tapos na nga ang pandemya eh.
Oo.
Para mapipisil ko ang iyong mga
Yes. Ma'am, I give the virtual floor to you.
Thank you very much
for being here. Salamat po.
Siguro dapat i-correct ko some of the items there, no? Kasi medyo may mga tapos na akong mga ng mga binasa mo, pero maraming salamat sa inyong introduction. Okay, Miss Katkat, are you controlling my slides? Miss Katkat?
Care of Care po, ma'am, or tech.
Okay, Kier, are you the one controlling my slides?
Yes, ma'am.
Okay, paki-show na. No?
Okay po.
All right, okay. So, a good afternoon to everyone, to Dean Arminda Santiago, who so accurately reminded us of the situation when COVID-19 began to rear its horrible spikes in our country, and also for beautifully stating the rationale and setting the tone for today's webinar. Okay, to VP of Corporate Communication of Nickel Asia, Mr. Jose Bayani Bailon, whose good looks we are missing this afternoon, but whose words are truly appreciated. To PPI Executive Director Ariel Sebelino, moderator, facilitator par excellence, a person of wide knowledge, which is why he is such a gem to engage in conversation with. To CMCFI ED Risa Silvestre, our very hardworking Executive Director. My learned co-speakers this afternoon, Professor Beng Mortel and Ms. Diane Mendoza. My dear colleague and partner in many, many crimes, Executive Director of the PSSC, Dr. Odette Portus. Dear friends, a very warm greeting of good afternoon. Next slide, please. Naka-show na ba ang slides? Kier, naka-show na ba?
Yes, okay. Ma'am.
Yes.
Thank you.
Yes.
Okay. This afternoon, it's my pleasure to speak with you about a health literacy framework that we have used in actual health communication studies. I will structure my talk along 3 general topics, and they're right there in front of you. No, I begin with a short conceptual basis for a health literacy framework. And then I continue with a presentation of a competency-based health literacy framework, which we use in the 3rd bullet, no, applying it to a COVID-19 health communication program. Okay. Next slide, please. Okay. What is health literacy? Okay. Well, to define this, we have to get back to what literacy is. For centuries, literacy was always coupled with power and domination, especially in the political, economic, and even in the religious realms. It remained for centuries a very restricted technology closely associated with the exercise of power. Hence, literacy is knowledge plus power. It was only with the book, when book production started growing, that literacy among a general population began to be recognized as important. There's a commercial angle to that, but we have no time to get into that right now. No. But indeed, literacy leads to knowledge and knowledge to power, even in situations where people encounter difficulties. Literacy is a driver of development. The UNESCO has long advanced the cause of literacy, recognizing its impact on empowering and enabling people for full civic engagement. It was recognized that, and I'm quoting, rather than an end of itself, literacy should be regarded as a way of preparing man for a social, civic, and economic role that goes far beyond the limits of rudimentary literacy training. Reading and writing are the rudimentary ones, no? And this should not only lead to elementary general knowledge, but to training for work, increased productivity, a greater participation in civil life, and a better understanding of the surrounding world. Next slide, please. Whereas before, literacy was equated with knowing, reading, and writing, a third R was introduced, no? Arithmetic, no? Or numeracy, mathematical literacy, which means the ability to understand and apply basic concepts of arithmetic, to daily life. Okay, for a long while, literacy, reading and writing, and numeracy were regarded as the key measures of a population's functional literacy, necessary to achieve the first of the sustainable goals, poverty eradication. But now, we understand that literacy has many dimensions. And on top of that, literacy is now recognized as a human right, not a privilege. Consequently, literacy has become something equated with freedom. Literacy goals now emphasize the needs to be inclusive, which means that whatever the literacy is, it has to be accessible, available to all, regardless of age, gender, income, race, and differential abilities. And literacy has to be flexible because it should accommodate the plurality of literacies. No. We have overcome the simplistic notion of literacy, and now accept that there are multiple literacies that are needed by people to effectively and efficiently operate in a modern society. The UNESCO says that the term literacy has begun to be used in a much broader, metaphorical sense to refer to other skills and competencies, which is why we talk about information literacy, visual literacy, media literacy, science literacy, health literacy, and in our context for today, a specific type of health literacy, which is COVID-19 literacy. Oh, and one more thing. Literacy is more complex than being a dichotomy. One is not either literate or illiterate. One does not have it isn't a situation where a person has or does not have literacy. So literacy, take away that notion as something that you have it or you don't. Okay. Next slide, please. Why? I hope this next slide will make that clearer. A strategy framework for promoting ICT literacy for Asia Pacific that I was developing in 2008 reflected this multi-dimensionality of literacy. No? So literacy, to me, and to a lot of other writers on literacy, talk about dimensions of literacy. And these dimensions, I have distilled into three, into three. So what are these three? I hope you are seeing them, because actually on my screen I cannot.
Yeah, we're seeing them.
Okay, thank you very much for the assurance. The first dimension is knowledge. Knowledge, which is familiarity, understanding how something can be used and is potentially beneficial, to his own and other people's lives. Then there's the dimension of skills, because beyond knowing, you have to be able to use it, to experience the technology. And then on top of that, is the critical skills, where what we talk about in terms of social and ethical competencies lie. Okay. But I have to confess to all of you at this point that meron na akong nakitang kulang dito sa tatlong dimensions na ito. And I hope to make it clearer later on. Next slide, please. Okay, again, I'm showing you the dimensions, where the main point of this slide is to say that that there is a movement, Kasi nga, literacy is not something that is there or is not there. Literacy is there. Literacy develops, such that a movement from one dimension to the next represents an increase or an improvement in proficiencies and competencies. Literacy in all its forms, can be distinguished, along three major dimensions. Again, knowledge. Second, skills relevant to using the technology. And the third, to attitudes accruing from a critical reflection, of the use of technology. Okay. Next slide, please. So inherent in this definition is the recognition that there are varying levels of literacy. In fact, it is possible to locate literacy along a range of proficiencies. And I hope that is obvious to you here. That these proficiencies move from simple technical skills to the more complex critical thinking abilities. There are 7 proficiencies here. They're not mine. I adopted them from other writers. But I wish to go now. You can read more about this later on, or maybe ask questions about it. But now I want to go to the next slide. Okay. By bringing together those concepts of literacy into a health literacy framework, which I call a competency-based health literacy framework. Now, in the area of health, literacy requires a complex group of reading, listening, analytical, and decision-making skills, as well as the ability to apply these skills in a health situation. Previous writers have defined health literacy as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Okay. And an individual's health literacy impacts the overall health status of a population. We know that. We experience that now at this time of the COVID pandemic. Somebody does not wear a mask because that somebody is, either does not want to conform with minimum health protocols, or may not have a mask, or may not know about how masking limits the transmission of the virus. doesn't affect him or her only, it affects all of us. We know that now. I think the little example, the experience of our, of JB, who told us about his experience of contracting COVID, is a lesson, not just for him, but for all of us. The health literacy of an individual impacts on the overall health status of population, which is why one's health, it is important not to develop an individual's health literacy, but rather an entire population.
Correct.
Okay. As shown by research, those at lower health literacy levels will be the ones more likely to skip medical treatment, not adhere to medical and health regimens, misread prescriptions, self-medicate, and also deliberately miscalculate medication or completely miss out on consultations and doctor's appointments. Consequently, the economic and social costs of low health literacy are high healthcare costs, increased risk of hospitalization, and population mortality. We know that now. Okay, next slide, please. The next 3 slides show you, sort of itemize, operationalize further the competencies that are needed at each dimension. So what I'm showing you right now are the key competencies for foundational knowledge. When can you say that somebody has foundational knowledge? Yeah, there's an understanding, some understanding, of the body, the nature and causes of diseases. Knowing how one contracts a disease, knowing also how to look, for health information, and importantly, a health provider. Those are some competencies of an individual where you can say that that person has foundational knowledge. The next slide shows you what are identified as competency. So again, this is more of an operationalization for the second type of dimension, which is technical skills. And you'll notice that one of the technical skills is a communication skill. It is being able to tell a doctor, tell a healthcare provider, what is wrong with you, what you feel, and to ask as well. The third dimension, the key competencies for the third dimension is, which is critical assessment, is the more critical, the ability to evaluate information. Tama ba yan? Tama ba yung mga naririnig ko? And I won't go into the details because sometimes, itong sa COVID, diba, the treatments for this one, nag-away-away ng mga magkakaibigan, diba? But anyway, how, key competencies for critical assessment really apply to an individual's ability to make judicious and responsible healthy choices, not only for oneself. Remember, especially because one's health impacts on others. On others, the judicious healthy choices, not just for oneself, but for one's family. I guess the question that should now be asked is, how useful is this competency-based literacy framework that I just presented? How useful? Especially now, when the public health concern has caused a pandemic that forced the whole world to move into a new normal. And especially now that ours is a VUCA world. VUCA, volatile, uncertain, complex, ambiguous. Doesn't those 4 adjectives apply to our situation now? So which is why, next slide please. I'd like to walk you through. Let's apply the competency-based framework to this public health concern, the COVID-19 pandemic. And let's begin where it all began. No? What can we say about the health literacy of Filipinos when the COVID-19 public health crisis began? I'll show you some slides, no, that show a picture. No, this slide, no. To answer that question, no, what was the health literacy of Filipinos when it began? Now, let me show you a picture, no, about how it was about 14 months ago. No, in the minds, no, in the perceptions of people, 14 months ago when we all first experienced the lockdown. Now you'll see 3 graphs here. No, on the first graph on the left side, no, it talks about the level of concern, no, whether people are concerned about the COVID situation in the country. All right. You'll notice that in the difference, no, in 2 weeks' time, no, the first wave of data gathering was from March 16 to 21. No? And you'll see that meron dyan, no? So 61% are extremely concerned, 29% are very concerned. But give it a few days and tumaas na. No? Tumaas na ang concern. More people expressed extreme concern. See, there was heightened in that period, in just that little time. And where were you when the ECQ, was laid down on us, when the lockdown? So talagang may concern naman tayo. No? The middle graph shows you answers to the question, no, how long did people think, no, the outbreak will last in the country? No? Again, between these 2 time periods, look, there was already an increase. So what we can say is that we're still having the outbreak, right? So who would have thought, no, that it would be longer than a year? The last set of graphs here shows you the approval of government efforts. No, the percentage of people who say that they approve or disapprove of how their country's governments have handled the outbreak. Incidentally, this is not just Filipino data. This is across the region. Okay, and so what you can see here is that there is increasing disapproval. No? So that was the situation across many countries, and it reflected also very similarly what was in the mindset of Filipinos. Bottom line, it was very volatile. It was VUCA. VUCA is volatile, right? The COVID-19 pandemic, as we all know, posed both a humanitarian and a communication problem. The pandemic and the government response to control its spread by imposing various levels of community quarantine really left people dealing with the uncertainties for everyday survival and questions about the disease and how to protect themselves. Let me show you now the sentiments of Filipinos through this period. Next slide, please. Look at this. What are all these lines? These are the lines of emotions, that people expressed. How were these measured? These were, how many of us have social media accounts. And because of the characteristics of social media, because of VUCA, a lot of us have turned to this media to express our emotions. No? So what the data show is that, again, over a month's period, these are the emotions as expressed in the sentiments that were put out in social media posts. The yellow lines, which are the highest there, are anxiety. The red lines are anger, reflect anger. The green lines show empathy. No, there is anxiety. no, anxiety is the highest, no, anxiety, and then anxiety, empathy, anger. Bottom lines are, will you look at that? Optimism is low, and boredom is right there at the bottom. You know, these are expressions of sentiments in the social media. So one can say that the social media helped. No, parang may release ka. But the social media also hurt in the spread of misinformation. You know, next slide, please. Okay, this is the same graph of emotions, no, where the peaks are indicated, no, nandiyan yan, no. Kailan yung panahon na mataas ang anxiety? Yan yung panahon na merong the news about the impending lockdown. Yan. Siyempre nga naman, nakaka-anxious nga yun, no? And then when a 22-year-old got infected by COVID-19, nung sinabi nila, hindi, medyo safe naman ito para sa mga adults, di ba? And then but empathy, tignan nyo ha, ang bait ng Pilipino. Ang taas ng empathy natin throughout that first period. And we can say that this was bayanihan, which we are still experiencing now. You know, may bayanihan Diba, may panahon ito, take care of take care of our healthcare workers, diba? Ang nakakatuwa dito is yung nandito, itong kasi unang-una yata ang Ligo. No? On March 25, people thanked Ligo for donating their entire advertising budget. No? Parang nakikita yung empathy, and then throughout may mga other expressions of bayanihan and donations for our frontliners. Anger, no, nandun syempre, at saka tumataas, bumababa, pero pataas at pataas pa rin because of the perception of slow action and measures against the virus. So this was the picture. This was the picture of us, no, about 14 months ago. Okay, next slide, please. Heeding the need to improve communication about COVID-19 in the country, we, a group of UP social science researchers and media and communication specialists, put together a project to develop a research-based COVID-19 plan. You know, I was so optimistic pa at that time. I thought that the quarantine measures would be temporary. No? So I started talking about communicating COVID in a post-quarantine world. But guess what? We are still in NECQ, a never-ending community quarantine. But nonetheless, we, the project team, focused our energies on determining strategies and messages that would instill healthy behaviors and practices supportive of the transition to a new normal. So towards this goal, what did we do? We did a lot of things. No? But the one that I want to share with you this afternoon are, we studied COVID-19 communication content in select media, and we also tracked the sentiments that were being put out in the social media. And then we also assessed COVID-19 literacy among the public, because we believe, as I still believe now, that the effectiveness of a COVID-19 public health campaign is anchored on building the health literacy of its audiences. And the key to building COVID-19 literacy among Filipino audiences is to understand their situations in terms of media access, literacy, and the message and media content. Next slide, please. So we applied the competency-based health literacy framework. So you notice here that in our objective for measuring health literacy, we talk about cognitions, knowledge. Kasi di ba, dun sa framework that I showed you a little bit earlier, it's knowledge, di ba? Knowledge that's important. Sure. But are you seeing the gold arrow?
Yes, ma'am. Yes.
Yeah, the gold arrow, pointing to sentiments. You know, I had a feeling, no, because after going through the sentiment analysis, no, going through the data about how people put out sentiments, no, in the social media, because the social media are there, I had a feeling that sentiments, no, had a role in literacy, no. And yung nga sinasabi ko sa inyo ngayon, no, I think I am rethinking. No, I know I am rethinking. What the dimension of the foundational knowledge dimension of literacy. Sentiment must be there. No, so truly, I was beginning to think that VUCA, volatility, uncertainty, complexity, and ambiguity has to be considered in measuring literacy. In this case, COVID-19 literacy, but I feel it's applicable in all types of literacies. Yeah. Next slide, please. Okay. Actually, first time ko ito sa public presentation ng data na ito, ha.
Wow.
Parang kayo pa nga ang unang-una.
Yeah.
Oo. Hindi pa nga, ewan ko nga. Kaya I cannot share with you everything because this is a study that is funded by the PCHRD, the Philippine Center for Health Research and Development, and funded by the DOH. No? In fact, we are wrapping up, just completing the data. So what I am sharing with you are little snippets of the data. Okay. So game pa tayo, no? So ang sinasabi ko kanina is that knowledge, yes, the health literacy framework, no, competency-based literacy framework is useful, but at the same time, a framework is, a framework must be. Kasi di ba kung same old ang gagamitin nyo, wala namang kwenta ang same old, no? Kaya nga, the framework, is in process of rethinking and redevelopment and refinement. That's how it is in research. That's how it is when we do concept development and theory development. No, which is why I'm also happy about the outputs of this research, not just in terms of the communication and the media collaterals, but also its contribution to a refinement of a health literacy framework. Okay, now let me show you some So now the question is, what do we know now about the COVID-19 health literacy of Filipinos? Next slide, please. Ito, in terms of knowledge, self-rated knowledge, more claim to be knowledgeable about generally COVID-19 than those who have little or no knowledge. So the blue bars are higher than the yellow bars here, than the gold bars here, diba? The first set of bars are about general COVID. The middle set of bars are the same thing, about the transmission of COVID-19. Again, more report being knowledgeable about how COVID-19 is transmitted than those who report no or little knowledge. And the same thing about prevention. Pero mas mababa ang may ala among those who confess to know how to prevent it. Should we be happy? Pwede na siguro, pero hindi eh. Ang taas pa rin ng mga tao na nagsasabing maliit o wala silang kaalaman. These quantitative data were verified, by qualitative data. The study and our qualitative data did show that individuals had pretty good sense of COVID-19 knowledge literacy, and their awareness and active participation in discourses regarding COVID-19, they reported that. So madalas nila pag-usapan yan. And it is speculated that this active participation and high interest in participating in conversations stem from the lack of information on the nature of the disease, hanggang ngayon naman, di ba, we do not know everything about COVID. What worked before doesn't work now. What we know yesterday, na iba na today. No? So, and then there are differing, there are statistics that are show us large increments, in the number of cases and deaths, so that naturally people would seek information from multiple sources. Whether these sources are reliable or not, that's another thing. So the virus has shown interest, curiosity, fear, and panic. Fear and panic. But when it came to vaccines, there was low knowledge, low awareness on the science behind vaccines, as well as low awareness, low knowledge about its uses and benefits. Also, unfounded beliefs and speculations. Okay? Next slide, please. This next slide focuses on sentiments. Remember the sentiment graphs that I showed you a little earlier?
Yes.
Well, this one extends that. This one extends that until January 2, 2021. So you see those spikes there? Yan. I summarize for you. You look at the at the terms on the right side of the graph. What is high throughout, although bumaba, are anxiety and fear. Anger and hate remain, but less. But there are still some spikes. Diba? Empathy, yung tatlo na yun, anxiety and fear, anger and hate, and empathy. Were still obvious from the conversations, throughout the year. Undoubtedly, there was a flattening out, but they were still there, and still, hope and optimism and boredom are border low. Okay, all right. Let me just show you some of the words. Mabilis lang to. Show lang ito. Yan. Ito. Kasi alam ko, sumasobra na ako. Okay lang ba, Sir Ariel? Okay lang ba sumasobra na ako ng oras?
Go. Probably like how many minutes more, Dr. Nani, do you have there?
At least 8 minutes.
Okay, go. Okay, sure.
Okay. So eto.
Mahirap
Makita ko
na
lang.
miss out. Mabuti yung makita niyo yung kabuuan, di ba? Oo.
Hindi pa nga ito buo eh.
Kaya nga, snippets lang pala ito, Yeah. Okay, go.
Tapos, pero ito, this is what I want to show you now. Vaccines and vaccination.
Okay.
Why? Because nga, our research indicated that yung about COVID, meron namang may alam. Pero pagdating dito sa vaccines, yan yung mababa ang knowledge. Where we can say that literacy about vaccines was definitely low. And this is the picture of sentiments throughout the period from last year to January. So this is a full year, a 12-month picture about sentiments that were about vaccinations. So you're going to see na ito, sa simula may anxiety, may fear. Throughout, in the middle period, may galit. What were the triggers? Nandun yun, dun sa maliit, dun sa taas. What were the triggers for anxiety and fear? Nandyan. What are the triggers for anger and hate? Kasama dyan yung yung merong mga nauna. Bakit naman sila nauna doon sa vaccination, di ba? And then merong distrust doon sa mga vaccines coming from certain countries of the world. Tapos dito sa bandang dulo, and in most recent times, nandyan yung empathy. Feelings about empathy. So sino ba at saka call for donations para lahat naman magkaroon ng vaccination. So this is the picture. I have shown you some relevant data, and what we realized was health literacy when it comes to COVID. And we want to contribute to it. We have to focus on developing a literacy. For not all aspects of COVID-19, but for vaccines and vaccination, because that is what is important now. No? And what we wanted to show was, and remember I told you a little while ago, my rethinking about what health literacy includes. No? So to move away from a more cerebral approach to a more emotional approach. Let me show you our, just a couple of our communication collaterals. No? Kasi we felt that kung mag-explain ka lang, mag-explain, matagal pa yun mag-develop ng literacy. But we hit at emotion. No? And you saw naman when I showed you those pictures of sentiment, fear, anger, ang nasa taas. Diba? We don't want to contribute to the fear. We don't want to contribute to anxiety. We don't want to contribute anymore to the anger. But we want to contribute, but we want to anchor it on important values, for Filipinos, which is love, because love is the opposite of fear, and family. Because as I told you earlier, a public health concern, an individual health is insufficient. There must be an understanding that one's individual health impacts upon everybody. So may I show you? Can you play it now?
Care.
Can you press? Care. Can you press it and play it now? Yeah.
Birthday, mahal.
Thank you, mahal.
Happy birthday,
Mommy!
Hi, Dad! Hi, Mom!
Birthday, mga anak! Thank you.
Love you, Mommy!
Miss na namin kayo.
I miss you, both of you. I miss you. Miss ko na kayong lahat.
Mommy, sana magkakasama na tayo muli.
Miss ka na namin, Mommy. Happy birthday, Mommy.
Miss and love you, Mommy.
What did you wish for, Lola?
My wish? Magpapabakuna na ako.
Ako din.
Dahil mahal ko kayo, magpapabakuna ako.
Galing.
So we felt that one way of improving not just behaviors related to vaccination was also to address the fear, by putting out the message that getting vaccinated is an expression of love and will allow you to get together once again. The next slide, please. I'll show you one last video.
Mahalaga ang lakad na ito. Tigasin ka ba?
Siyempre!
Mahal ba si Commander?
Mahal na mahal.
Pare, mahal mo ba ako?
Oo naman, ano?
Mahal mo ba ang tropa?
Oo ba?
Tara na, magpapakuna na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Yan. At dyan ako nagtatapos sa aking paglalahad sa inyo ng itong saliksik namin sa paggamit ng health literacy framework. I apologize. I am exactly 8 minutes over time.
It's
Thank
okay,
you.
Ma'am Neni. Maraming salamat, Dr. Neni. Nako, umpisa pa lang, I'm pretty sure ang dami nating natutunan na. Ako, more particularly, ang dami kong take-away tsaka lessons nakuha kay Ma'am Neni. On top of that, hinihikayat ang publiko to really get vaccinated. That's really very important, Ma'am Neni. Ako, I for one, yung parang, sariling advocacy ko din dito in the neighborhood is to really impress on them the importance of being vaccinated, no matter the brand. Sabi nila, wala naman tayong choice kundi magpag-vaccinate talaga. If you're taking care, if you really want to take care of ourselves or our family, sabi mo nga kanina, neighbors natin, so isang komunidad na ginagalawan natin, Go out and get vaccinated. That's really very important. But apart from that, ang takeaway ko doon yung dimensions and competencies na kailangan natin in this age of in the middle of a raging pandemic na madami tayong misinformation, disinformation, malinformation all around us. Kailangan natin ng skills na binabanggit ni Ma'am Neni. I think ito yung magiging instruments and tools natin para harapin ang realidad on the ground. Sa tingin ko, with all this, ang dami-daming impormasyon na nakuha, Ma'am, sa social media, sa internet, sa mga tao na kapalibot sa atin, it will take sinasabi ko dito, not only snippets of knowledge, but I think komprehensibong pagtingin sa isang importanteng bagay like health. Kasi this is one matter closest to our hearts, di ba? Nasa bahay tayo, ang dapat pag-usapan natin. Kaya binanggit ko kanina, Ma'am Neni, and to all those watching us right now, normalize conversations on health. Kasi probably that's the only way to get us out from the anxiety and fear. While all of us are harping about our being resilient, di ba, Ma'am Neni? Pero sabi mo nga kanina, paano ba tayo hindi mako-consume ng fear, ng anxiety? Hindi tayo mako-consume ng fear and anxiety pag meron tayong knowledge, pag meron tayong skills, pag meron tayong competencies, and we can get all the help that we need, not only from our family members, from the people surrounding us, di ba? At sa gobyerno na din, kung may tutulong yung gobyerno para yung kalusugan natin sa pag-iisip at saka sa emosyon natin. Tama, Ma'am Neni? I think that basically says it all. And we so thank you for that, Ma'am Neni. Very insightful and very incisive. Sa tingin ko, babaunin namin ito habang makikinig pa rin kami sa other resource persons natin ngayon. And please stay. Of course, you are going to stay for the open forum kasi I'm pretty sure ang dami ng mga nasa percolating in their minds, Ma'am Neni. Thank you very much, Ma'am Neni. On to our second presentation, ladies and gentlemen. I'm so excited also to hear from the health promotion, a discussion on health promotion and development in the time of COVID-19. A very good discussion as well. Let me just present to you our expert. She was the chairperson of the Department of Health Promotion and Education, DHPE, from 2004 to 2010. She completed her Bachelor of Science in Public Health and Master of Public Health from the College of Public Health, University of the Philippines. She also completed the academics subjects and passed the comprehensive exam of the Doctor of Public Health program in the same university. She teaches undergraduate and graduate courses offered by the DHPE. This includes general health promotion, socio-cultural determinants of health, communication in public health, and human behavior in healthcare organizations, among others. She is also preceptor in both undergraduate and graduate field practice courses and serves as a research advisor in special studies. She served as consultant in health promotion of government and non-government agencies. Consultancy projects included risk communication, training by the Department of Health and World Health Organization, evacuation of the hospital management training of the National Institute of Public Health in Cambodia with GTZ and Simeo CHOPMED, health promotion in nutrition with Simeo, Regional Center for Nutrition in Indonesia. She served as coordinator of the Public Health Leadership and Governance Program in DOH Region 4A. And he has been invited as a resource person on various areas of health promotion nationwide and is a journal article reviewer of Actum Medica. She was awarded the UP Manila Faculty Grant and Professional Chair. She serves as the University Registrar of the University of the Philippines, Manila from 2011 to 2014. Please welcome Assistant Professor Buena Teresita Armortel, MPH, Chair of the Department of Health Promotion and Education at the University of the Philippines, Manila College of Public Health. Hi ma'am, magandang hapon po sa inyo.
Magandang hapon, Ariel. Magandang hapon sa ating lahat.
Kumusta na po kayo?
Mabuti naman. Nandito ako sa koleyo ngayon. With the proper public health protocol.
Wow, that's good. That's good. That's also a lesson for everyone, ma'am, watching us right now. Thank you very much for joining us this afternoon. We're so glad that you're able to make it, and we're also looking forward to your presentation, ma'am. Thank you so much. I give the virtual floor to you.
Okay, thank you very much, Riel, and hello once more. also to the other resource persons who are present here. And thank you to Dr. Pernia for providing the context and also the framework of health literacy and literacy in general. Okay, so will I be sharing my slide or will somebody be doing it for me?
Somebody can do it for you, ma'am. Yeah, that's it. Yes.
Okay, marami. So I just have to say next slide.
Yes, right. Yeah.
Okay.
We're seeing the first slide right now. Yeah, you're good to go. You're good to go.
Okay.
Yeah.
So I come from the health promotion field, from the other side of things, but also dealing with the communication side. And I'd like to offer some insights on how we do it in health promotion, how the health literacy figures in our framework as well, and would also be providing imperatives of really working on literacy, especially in this time of COVID. And we've been a very active partner of the government and non-government agencies. And essentially, we'd like to share how it was for us for more than a year already. So more than a year of lockdown, but not necessary looking down. Okay. So may I have the next slide, please? So does anybody recognize what this figure is?
Yes po.
Okay.
Masarap.
Masarap yan, lalo na pag Pasko, malapit nang dumating. O kahit hindi Pasko, dumarating
Opo.
na itong bibingka.
Yes, true.
Okay. You see, bibingka, the analogy of bibingka is also similar to health promotion. And as most of you know, bibingka will be cooked only when there's fire from above, as you see the coals on top, and also the fires from below. And that represents fires from on top would be the fires coming from your decision makers, from your lawmakers, or people who can change the environment. And fires from below would be coming from the people who you would like to work with, whose behaviors you would like to influence. And so what we say in health promotion is that we are applying the bibingka approach. That when we try to work on interventions, it's not only at the level of the target audiences, but also at the level of people who can change the environment and make things happen. You see, this analogy of bibingka has already taken the textbook, the international textbook of health promotion. And we were just so happy to note that it was a Filipino example that they made use of for bibingka. It was first used by then President Fidel V. Ramos when talking about how collaboration would be like. And so it is in that context that I'm making use of bibingka, because there are action areas in health promotion, and part of it, the fires from on top, would be developing your policies, creating your supportive environments, and also reorienting health services. I'm just naming them so that we provide the context for health promotion. And the fires from below would be on developing communities and also developing skills and strengthening what we have. And so when we do health promotion, both need to be present. Hindi maluluto ang bibingka kung nasa itaas lang ang apoy. Ganun din, pag nasa ilalim lang ang apoy o masyadong engaged ang mga tao pero wala namang suporta, hindi pa rin maluluto. And thus, what do we say? It has to be the bibingka approach where you have the fire on top and the fire from below. So when you think of health promotion, think of the analogy of bibingka. Okay?
Yeah.
So may we have the next slide, please? I would then like to put into context the health literacy from the health promotion side. See, Dr. Pernia has shown us the framework coming from the different domains and very specific matters. Now, I would like to situate health literacy as one of the three pillars of health promotion. And that's why we're so inextricably linked with each other, the communication side, because these pillars of health promotion are said to be the different strategies or approaches that we would need to further the sustainable development goals. So in the conference of the Shanghai Declaration, it has been noted there are 3 pillars of health promotion that is important for us to achieve the sustainable development goals in the year 2030. And so when we focus on the health literacy part, you notice also, before I go to the health literacy, try to look at the other components here, the good governance, which talks about healthy governance and people really carrying out or the leadership and how it affects how health systems would be like. We also have the healthy cities, which would be looking at the cities not just only from the health perspective, but from an intersectoral point of view. And being healthy is not only being free from disease, but also addressing the different determinants of health. And so you have good governance, you have healthy cities here as the 2 pillars, and the 3rd pillar for health promotion within this context is on health literacy. And as defined in this particular framework, health literacy here is in increasing knowledge and social skills to help people to make the healthiest choices and decisions for their families and themselves. I think Dr. Pernia also mentioned that when we make decisions for health, these are not just for ourselves, especially for those decision makers in the family. We are also trying to work on decisions that would impact our family, especially when you're the designated decision maker for health. And so the health literacy here comes in the form of also partly working on the Bibingka approach, but also looking at how do we increase the knowledge, not just knowledge, but social skills, because we're also working with people, and these are important life skills to be able to survive, to be able to thrive, especially in this pandemic. And it gains more traction at this time because of the current pandemic situation. The need to increase knowledge, because that's where it right now. And so health literacy also empowers and also drives equity issues here. Sometimes when we talk about health, it's not really absence of health or absence of disease, but one of the definitions of public health that I so like is that it's the use of power to be able to reduce the inequities in health. And by power, we mean not just the formal power, but power also coming from the people, so that we reduce the inequities in health, and thus providing access and providing lifelong learning as well. So that's where the health literacy component from the public health side is, as a pillar of health promotion and something that works well in really crafting very important messages. Next slide, please. Now, in the COVID-19 pandemic response, we were all caught off guard. At the start, it was only said, you'll have 2 weeks of, well, for our case, no classes, and we were not asked to go to work even before the declaration of the actual IATF declaration. But here in the city of Manila, we were already asked not to go to school because of the increasing risk of COVID-19, which we thought was only short-lived. At this time, we recognize the critical role of health literacy in promoting population health. It's not just on a one-on-one thing, but in public health, we're dealing with population groups. And so our target groups would not just be our students here, would not just be the families of our students, but also the people within the university, as well as our responsibility to the general public because of the particular basis that we have as the College of Public Health. And so we look at the critical role of health literacy in really mobilizing mobilizing efforts here and need for one, effective communication and community mobilization efforts. Remember when we were talking about the Bingka approach, the fires from below need to have strong community organization, needed to have the strong group that would allow people to make decisions about health to enhance protective and self-care behaviors. Now, at the start, and as was pointed out, we didn't know what it was or how best to protect ourselves because the information was changing. And so what we often tell our local government units when we would share insights about how to address and communicate this to their constituents was that this is the data that we have right now. And that is why this effective use of masks, no shield at that time yet, is something that would help prevent it. But this was the data. And soon enough, when there were additional guidelines that came in, he would say, because there was new data that came in, thus the need to also modify the kind of protocol. Also, to talk about how we would mobilize community efforts at the community level, there were also the disaster risk reduction management group or the IATF at the level of the community that was also organized. And so this group, the health, the disaster risk reduction group, plus the city government or the provincial government would then mobilize community to be able to enhance protective and self-care behaviors. So what's this? A municipal health officer in one province, for example, would sit in as an assistant of the disaster risk reduction, particularly for the COVID-19, and then would have his or her team of nurses and other doctors and a lot of DHWs to be able to share the information about it. But at that time, we noted also that DHWs were not adequately equipped to really give the information about COVID-19. And so there were also concerns about mobilizing communities because people also didn't know what to do at that time. And also they were just given information about how to protect themselves. But whether they accept it or not is something else. But because of the policy that came to it, there is already compulsion to really follow it is. And so we need to promote our health in time of crisis and beyond. Next slide, please. Okay. Now we see the central role in empowering communities and individuals in adopting effective responses and managing the psychosocial impacts of this pandemic. Okay. At that time, we were noting the trend also of the other diseases happening here. So what we note is that the interest of people was really on information about COVID-19. And everybody was bent on all the facilities meant for health were only on COVID-19. But we also noted that there were also health concerns that have been neglected as a result of the super focus on COVID-19. And thus, the need to empower the individuals and say, we need to do also the other things because this would also affect eventually the health of the communities. And one of the more important effects that we saw was that of the psychosocial impacts of this pandemic. It was not just among students that had a great effect on pandemic, but also on the adults that were confined here. And we were noting that in local government units where the adult population, particularly the more senior population, was not asked to go, there were some cases or there were increasing cases of psychosocial concerns. So the very young the not so young, and also the more senior group were also affected here. And thus, local governments came in also and tried to address them by working on one, communication, and also providing the necessary support that can be. One of which, for example, the need to have the medicines. You couldn't go out. One municipality worked on asking somebody, a team from the municipal health office, to be the one to take care of the medicines of the constituents there. And so somehow you know that even if you're confined, you know that you will still get your medicines. And thus, if before the community pantry came into being, there were already support coming from local government in trying to assist so that they would have a sense of connectedness still. Another thing that we note during the time on how they were trying to manage psychosocial pain was that people in general were looking to a higher being to hold on to. And thus, last year, during the time of the Holy Week, where people were supposed to go out of their homes, go to the churches and attend other religious services, what many local government units did was really to provide an online platform for all these religious activities. And that somehow took the place, got themselves connected again. It was not easy, but somehow it's something to hold on to that would bring them to a sense of community, something that would really allow them to have to respect their religious cultures and activities too. So empowering them because they needed to understand how can they be able to manage the situation. Next slide, please. Now, empowering people to gain control over the situation. You see, one definition of health promotion is a process of gaining control over the determinants of health and thereby improving health. And one way of allowing people to gain control over the situation is to empower them. And by empowering them, it could be in delivering the communication messages that would give them the information that would give them a sense of, yes, now I understand what it is, what the risks are, and how to protect myself. It's not that they're trying to have a sense of control by having the knowledge and seek for it. And also in a study that we had several months ago during the start of the pandemic, we noted that people really hang on to every information that they could hold on to. That's why it was word of mouth. It was also through the social media and little about the people who would go there. That's why it was at this time where we also thought of asking people to check what is the current situation or what would be the perception of people at this time. Because we wanted to understand also, is the kind of information that we are currently giving, that of protecting yourself from fear, enough already? Is it enough to protect oneself and others and to cope in living with the confinement we are? We were not used to this. We were used to having a workplace, our separate home, and then a separate leisure activity. But here, how do we gain control over the situation? And one of them is the effective communication and talking about the risks of contamination. But that information also changes over time depending on the kind of data that we have. Next slide, please. Now we say with COVID-19, behavior is still the most powerful treatment at this time until after the vaccine. I purposely did not put until after the vaccine because it will take time before we have a complete rollout or before we have that herd immunity, so to speak. But at this time, behavior is the most powerful treatment. And behaviors, we know the basic public health protocol of putting on your mask, putting on your shield whenever you're out, the sanitation, the physical distancing, and also limiting also the kind of gatherings that you would have. More so, part of the protocol also is not or to get only from credible sources of information the materials you would need to have. And so determine what would be the healthy behavior that would be powerful at this time that we really need to have till after. And when we get to the vaccination per se, health behaviors will not stop because by then we will still need to continue the disinfection because the vaccination would not be 100%, would not be 100% telling you're safe from it. But with other types of vaccine, you would not move on to the more serious complications because of the nature of the protection that's given them. But still, we would need to protect ourselves from COVID-19 and still follow the protocol. But now the balance would be empowering people because what we saw in communities was that people were so scared to move already because of the fear of contracting it. They were really purposely not going to their neighbors or their families because they fear so much and they say there's a lot at stake. And then to balance it with the information and saying, if you do this protocol, you will be fine. If you just wear it, if you just do your hand washing always and not touch your face or your nose and eyes, etc. Now, from one end, you have empowering them. And then on the other hand, it's not to make them feel too overly confident that they do not anymore do the public health protocol. And so that's a careful balance, I think, to my mind, would be important in really working on the kind of communication that we need to have. So, but we will be able to do that when we have a sense of how people are at the moment, what do they currently think and feel. Okay, next slide, please. Okay. Now, we'd also like to point out that in the health literacy, in the sea of information that is coming on right now, and also with the general expectation of how really to help ourselves, people need to, it's important to enable people and communities to acquire, understand, appraise, and apply the best possible knowledge and skills to cope with health threats, such as COVID-19, to empower them to apply these actions in their everyday lives. And so, in the vaccination that we are having right now, it's a very important message to say, what exactly can this particular vaccine do? My thinking is that we provide the general information and allow people to really make their choice and understand what kind of protection is given from these types of vaccine. I understand that there are some misinformation that's coming in. And the next question is, how do we try to make people having the critical skills to really determine whether it's coming from a credible source or not, or whether it's just muddling the issue and not helping in this vaccination rollout. You see, I think one of the important phrase here is to really appraise and apply the best available knowledge and skills to be able to do the healthy behaviors and to protect themselves from these health threats. Okay. And we note here that important channels on the study that we had were really still on the traditional media and social media because people still go up to them. And we noted that we thought it was really mainly on social media, but there have been reports that the use of television is also important in delivering the messages here. And so we need to understand also where we would reach our audiences. Okay. Next slide, please. Okay. At this time of pandemic, when we have greater expectations to control the risk, and we have this deluge of health information from different sources, the challenge now is to make sense of all the news and other information about COVID-19, given a high degree of uncertainty. Until now, the living protocol of infectious disease is still a living one and still could change based on the science that would come in. And that's why we tell people also, how do we make sense of the information that we have? Our call then, go for more credible sources of information. The more important thing to my mind is that you may be a credible source of information, but people needed to trust you. So people are looking for trustworthy and credible people whom they get their source of information. And that's why we also like to see, well, more trust in government actions in every way it's being done here, and also following the protocol that we have. And so in the current situation, how do you clear the clutter? How do you get into the heart of the matter and appraise which ones would be important here? And that's where our network, our health network, would be providing information, but really first to understand what is the source of their misconception at this time. Why do they feel that way? And then to match it with the kind of materials, the kind of information that they would need to be able to address that particular fear. And last slide. Next slide, please. Now, as we are here in this current pandemic, and as we also consider the current situation, we have some improvements right now. Our healthcare system has also been coping with the cases that we have. We have reduction in the daily cases, and that people are more aware. And we see also more people lining up in vaccination centers all over the country. And we see that while pandemic is here, it's still the individual that defines his or her role in this pandemic. Because it's people who try to make sense of the situation. And so one of the skills perhaps that we need to do as part of improving literacy is also helping people make sense of what the situation is by providing information that would give him that confidence to be able to. As I say, and I am reflecting on it, this is a piece of the puzzle that we need to put in so that health literacy would truly be effective. And as I go back to my analogy of the bibingka, we are looking at it from the point of view of the person, the behaviors that we're asking them to do. We also need to consider and partner with the people who can make things happen, or the coming from the fires from above, so that it would truly be an appropriate intervention that covers health promotion and particularly the health literacy as its pillar. So magandang hapon po sa ating lahat at isang hope we have a very worthwhile afternoon, everybody.
Maraming sa Professor Martel. Ang dami-daming uli namin natuto, as I said, from the beginning, from the first presentation to the second presentation, ang daming takeaway din. I like particularly very much what you said, a practical approach to health promotion. At you highlighted yung well-roundedness, look at it in terms of the pillars. Kasi sa tingin ko din, it's not just about the government there doing everything. at the heart of ito talaga yung tao din mang gumagalaw din. And also at the heart, yung society na naging health information literate. Binabanggit nyo kanina yung importansya ng effective communication para lahat ng messages na nasa baba ay ibababa na, nasa taas, ibababa natin. So I think yung talking about health, public health, as you said, the effective use of power to reduce inequities, parang social equalizer din yan, Professor Mortel, na pantay-pantay dapat. Gusto ko lang susugad, binanggit ni Ma'am Neni kanina, which is also related to what you said right now about social reducing inequities. Yung literacy is no longer a privilege, it is now a right. Diba? So having said that, you also mentioned about how important it is for the public to really appreciate yung bakit kailangan nating maraming knowledge in the time of the pandemic. Bakit kailangan natin mag-depend sa mga taong credible at makinig sa mga taong may kredibilidad na magpalaganap ng health at saka mag-promote ng health, as opposed to, let's say, the myths and all this disgusting misinformation proliferating in the social media, as I mentioned earlier. Thanks, Professor, for that. For those, ang daming lessons, and stay tuned for our questions from our participants in the open forum. Maraming salamat po. Ayun, shout out muna tayo sa participants natin all the way, na nandyan ngayon sa Leyte at saka Mimaropa region natin. Maraming salamat for joining us today. At hindi pa binanggit, marami pang schools na around Metro Manila din. Pat binabanggit ko lang yung napakalayo, kasi I think they're very really interested. They're very interested to learn from this activity. Okay, we started with a presentation from a media and communication expert, and then we have a public health expert. And now, let's go to a journalist, a media practitioner. Kailangan natin makita din, ma-appreciate din, ano ba yung ginagawa ng ating mga legitimate sources of information, yung mga taong, isa sa mga taong credible, ito yung mga journalists, ito yung mga media practitioners that amid the raging pandemic, ay talagang sinusugal nila yung buhay na, but of course, they're also taking good care of themselves para maihatid yung balita. So to tell us about the health reportage in the Philippines, matagal na kasi hindi nakita, pero once in a while nakakasalamuha siya pre-pandemic, dahil sa mga trainings, tapos yung merong mga forums. Okay, she's been in journalism for 3 decades. She covered the health and science beat in the Manila Chronicle and Today newspaper. Just imagine, gano'n siya katagal sa industry as seasoned journalist. And as a stringer of Reuters for much of the 1990s, she continues to write about health and social issues and contributes to the Thomson Reuters Foundation, Interpress Service, Rappler, Verifiles, among others. She is an associate producer and head writer of One Signal News TV. She's also co-founding editor and managing partner of Writing Women in the Philippines. Very commendable indeed. She's currently an editorial consultant of a Southeast Asian regional organization and a communications consultant at the Philippine Advocacy NGO. She is a University of Santo Tomas journalism graduate and a recipient of the Reuters Journalism Fellowship Program on Medical News Writing in the United Kingdom. Among the many recognitions she has received is the first prize in the Science Journalism Awards given at the Lopez Haina Journalism Workshop at the University of the Philippines College of Mass Communications Department in 2016. Please welcome Ms. Diana Mendoza to give us health reporting situation or condition in the time of the pandemic in the Philippines. Hi, Diana.
Hi, Ariel. Good afternoon.
Good to see you. Magandang hapon.
Good to see you.
After that last, natin forum.
Pre-lockdown pa yun.
Oo nga eh. I'll give the floor to you. Thanks very much for joining us.
Ariel, I will be quick siguro kasi nakalagay sa is hanggang 4 p.m. lang ako. Pero, siguro, for Sige, can we start now with and then can I turn off my camera? Si Ariel na lang po ang pagmasdan ninyo kasi cute siya eh. Saka na natin kurutin yung kanyang mga display. So can we have the slides na? Si Sir Kier,
Yan,
okay.
Oh, yeah.
And then
We're
the first slide po. Yan na. Nakikita ko rin.
Yes, very good.
And then the next slide, please. Umpisa na ako. Diretso na ako. But I'm honored to be speaking with Dr. Dean Pernia and Professor Mortel. And let me start by showing by saying ito yung well, as a journalist, ito yung mga unang reports. January 30, eto, nasa Baguio ako noon, pababa ako, and then nakita ko sa news advisories, may first case na. So this was a Chinese woman who arrived in the Philippines from Wuhan, China. And then after a few days after that, there was a man who was with her. He died. So he was this first case of death outside of China from COVID-19. And then on March 7, eto na-report na yung first case natin ng transmission. Next slide, please. These are the numbers. Well, as of May 25 dapat. So, ito po ba yung parang hindi ito yung latest na binigay ko. But anyway, these are the numbers and bilisan na lang natin itong slide. Baka makatrigger tayo ng mga sentiments, sabi nga ng dalawang speakers. Kasi ang dami ng numbers na nakikita natin every day. So, di ba, mabigat sa damdamin. So, next slide, please. So, it's been more than a year and we have seen some milestones I'm not even sure if milestones ang tawag doon in the health and science of COVID-19. And last month, scientists agreed that SARS-CoV-2, can we go back to the slide prior? Okay. Next slide, please. And then yung next po. Okay. There's a slide na Lancet po yung okay, I think you have my hindi updated na slide. Hindi updated na okay. Anyway, I'll just go through with it. Na-update ko na kasi yung presentation. But anyway, it's been more than a year. So, according to the Lancet is a peer-reviewed medical journal based in the UK. Airborne yung virus and it can stay in the air for a while and yung transmission can be through droplets. So, Ariel, are we okay? Si Ariel lang. Okay. Wala kasi yung slide.
Wait. Wala. Baka ina-up. Siguro, okay, just a little time.
And tuloy lang ako. And very quickly, we know that the vaccines produced by pharmaceutical companies around the world can protect against coronavirus infection. So, when they asked us to wear masks and face shields, we followed kasi ini-inform tayo ng scientific community, ng medical community, and that these are preventive measures. So nag-follow tayo, di ba, nakamask tayo lahat.
Correct.
But as we go along, the global and scientific community are still looking into many things, including variants, mutations, and other probable causes of deaths. And most recently, ang tinitignan nila yung mix and match. Kung nag-Sinovac ka nung first dose mo, pwede ka bang mag-AstraZeneca? So they're looking at that, the DOST natin in the Philippines and other groups and institutions in the global and medical scientific community. And we're still waiting for the story. Everybody's waiting for this. Ano yung origins ng SARS-CoV-2? Anong nangyari sa Wuhan? What happened? So ang daming theories na, but then I don't wanna go into that kasi even journalists are not allowed to go inside China, inside Wuhan. Pati WHO ay nilang payagang pumasok. So, wala pa po yung slide. Sorry. Okay. Okay, we're showing our ATM. Ito yung mga sources ng news of the media. We have DOH, Research Institute for Tropical Medicine, WHO, CDC, is the Centers for Disease Control and Prevention in the USA. Can we have the next slide? Ayan, yung CDC, WHO, next slide.
Ito na yung updated, Diana.
Yeah, oo.
Okay,
the British Medical Journal is, well, it's for doctors, but health journalists also read that. I know these things kasi for much of the 1990s, I was a health reporter. Ang mga sources namin on slow news days ay magbabasa kami ng mga ganyan. Plus the UP Medical Journal. Buhay pa po ba yung UP Medical Journal? And then the HAIN noon, Health Action Information Network. It was headed by Chancellor Mike Tan. I think he's back, pero I don't know kung may newsletter pa sila or journal. Ibon, Data Bank had a journal also. Maraming pwedeng makuhanan ng mga storya noon sa health. Kasi ito yung mga studies. So kung walang storya, walang nangyayari, yun, magpapasa kami ng mga studies in these journals. And kung kulang yung aming kung medyo bitin or hindi namin maintindihan, yun, hahabulin na namin, hanapin namin kung sino gumawa ng mga studies, and then we ask questions. So next slide, please. This is a picture of a photojournalist of Reuters. Hindi po siya doktor. And this shows us how some of us look during the pandemic while we're doing our jobs. And the world was unprepared. The Philippine government and the country's public health system were unprepared for this pandemic. And so were all of us. Hindi natin alam na ganito pala ang mangyayari. There were warning signs that another global outbreak of SARS-like magnitude would happen. But even before we knew it, we were already on lockdown. So next slide, please. So while the pandemic took on different shapes in different countries, many Filipino journalists not specializing in health reporting or who are not assigned to cover the health beat, they found themselves shifting to a new terrain. The task of reporting a story of extraordinary magnitude, unprecedented, is also changing journalism and how decisions are made in the newsrooms. So I'm showing you this, hindi ko i-define ito. Although I know the definitions, pero just very quickly, ang structure sa newsrooms is that there are sections. If we're familiar with yung mga newsrooms ngayon, may news, business, sports, lifestyle, showbiz, entertainment. And in the news section, there are reporters assigned to cover the beats. So you can cover the presidency, Malacanang, you cover the vice president, the Senate or lower house. Yung line agencies, DOJ, DILG, Defense, DOH. So from my training and experience, if you're assigned to cover DOH, it means i-cover mo yung buong health sector, hindi lang yung line agency. Not because it's the policy-making body, it's the implementing body on health. It's the entire health sector. And usually the science bit is added to it because it's thematic. And this is happening around the world. Nabasa ko sa New York Times, they're sharing their experience. May sports reporters sila and lifestyle writers na assigned to cover the pandemic. So sabi ng isang sports reporter, ang dami raw information. So para daw siyang umiinom sa hose. Yung pag umiinom ka sa hose, ang lakas ng tubig.
Correct.
Hindi niya alam kung anong i-filter niya, ano doon. Ang gagawin ko dito, sa sports siya nag-cover. So can we have the next slide? Okay. Health reporting is not for the faint of heart. Let me tell you that. Siguro 10, 15 years akong nag-cover ng health for much of the 1990s and in the 2000s, and then nag-freelance na ako. And health reporting is a huge responsibility. It's a difficult task. It's difficult kasi magbabasa ka, kailangan maintindihan mo ano yung sabihin ng attenuated vaccine, ano yung sabihin ng protein, lahat yun. Even SARS-CoV-2, you have to know how to define it. Eh diba, pag pinasa mo ngayon, isusulat mo na mamaya, ang hirap, diba? Or i-report mo na, magsa-stand upper ka na habang ang gulo-gulo doon sa pila ng vaccination. Naintindihan mo ba yung sasabihin mo to the public? Yun, ganun kahirap yung reporting. And it entails providing information to the public whose interest in the news may be a matter of life and death para sa kanila. So it really requires reading research, asking questions, asking experts to go slow on their jargon so that we are able to understand and so that our reports and write-ups are put out there with clarity and accuracy. Yun ng doctor, di ba? He finds it so difficult to explain ano yung sakit mo. You're a layman. Paano niya explain yun? So what more for a journalist to report the story the way he understood it? The most dangerous of all is if the journalist does not understand what he or she is reporting about. Yun, mahirap yun. So for editors and producers, I'm looking at the slide ito yung kanina dapat. So what I'm saying here is, ito yung Lancet. Okay, can we have yung slide kanina? Yeah, what I was saying a while ago, yung ever-changing, nasabi na ito ng first two speakers Yun nga, airborne yung COVID, yung SARS-CoV-2. Kaya lang, di ba, it took a while for the WHO to agree with the scientists. It took a while for the Lancet to even say, ito na, sige, susulatin na namin na airborne siya. Ultimong scientists and the doctors nag-aaway-aaway sila about it. And experts and local and global are still struggling to present their findings and the public to the world. Pati yung mga doktor nahihirapan, di ba? So, next slide, please. Thank you. Ito. Ayan, yung journalists need to do this, study, research, explain, itong mga, I'm just putting the questions kasi ito yung mga questions noong mga March, April, May. Ito yung mga tanong. Ano mo yung RT-PCR? di ba? Reverse transcriptase, yung ganon. Mahirap i-pronounce. Paano pa kaya i-explain? So, for editors and producers, the pandemic has made them find ways to create also and reimagine the storytelling. And can we have the next slide? Can I look at the next slide? Okay, and the next slide po. Okay. Oh, hindi po ito talaga yung naibigay ko na updated. Okay, sorry. In the Philippines, medyo malawak yung napakadaming platforms na ang media. In the 1990s when I was a news reporter, sa dyaryo po ako. So pag lumabas na yung article mo, pag may mali doon, mag-i-erato kayo. Pero nakakahiya. May mali Factual pa na mali. So ngayon, with online and all that, may podcast pa, may citizen journalist pa na nasa field, kaya lang kailangan niyang i-supervise kasi kaya nga sinabi ko challenge ito May Mojo is a mobile journalist and ang daming ganyan sa amin sa One News Signal TV and sa ibang stations I think they are being trained to do reporting sa field. And mga bata ito. So, it takes time. And ngayon, pandemic pa. So, imagine ninyo yung mga new graduates and they're out there in the field and they keep asking, so ano pong susunod kong pupuntahan ang itatanong ko? So, yun. We need, these challenges are here. And it's a bit difficult kasi walang supervision like social media. People go to Facebook, maniniwala na sila anong nakapost doon. So social media is not edited and supervised. Mga blogs, ganyan, doon sila pupunta. So, sana sa newspapers and TV and radio sila makinig. Although yun nga, meron pa rin mistake sa mga ganito. Because reporting is 24/7 is a cycle. So, meron kang trial and error sa paggawa nito. Can I see the next slide? Okay. We also have this problem yung ang ikli ng attention span ng mga tao and they're excitable. So kung kulang yung research ng journalist, yun, mahirapan intindihin ng tao kasi nga bitin, ano itong nabasa ko na 4 paragraphs, wala namang hindi niya explain. So in journalists na, wala silang rage, walang scoop mentality. And ang lagi sinasabi sa amin is don't get tired. We have to sound off the crisis or emergency, but a lot of us are tired. I'm sorry to say that, pero we soldier on, we continue. Next slide, please. Okay. So how are we doing so far?
Okay na. Diana, may ugong, parang may kulog on your end, from your end. Oo. Siguro, oo. Parang stamping out, paano ba? Ganun. Oo. Meron bang electric fan dyan, malapit sa'yo? Is there a fan somewhere?
Wala na ba? I don't know.
Ayan.
Okay.
Yan. Okay na.
Okay. How are we doing so far? As I've said, I spent most of my news reporting life in the health and science field. So ang primary sources namin are doctors and scientists, people in the fields of medicine and science. So under the pandemic, never pang nangyari ito yung hinahabol namin ngayon ay doctors of all kinds of specialization. Epidemiology, virology, pulmonology, immunology, infectious disease, public health. May iba pa nga kaming ini-interview or nag-guest sa TV na cardiologist. He was asked to explain bakit po heart attack yung ikinamatay nung may COVID. COVID affects the respiratory system. Yun na nga ganun ba? People don't understand it, so kailangan nilang maintindihan. Or a pediatric specialist na bakit nakasurvive yung batang ito, bakit yung isang bata hindi. So we keep asking questions even if the experts don't have the ready answers. And it's because kailangan pa ring tanungin yung mga kailangang itanong because there are committees also in charge of a lot of, alam niyo yung IATF, di ba? Merong vaccine panel, napakaraming I'm looking for that slide po. May vaccine panel, merong NITAG, yung maraming advisory bodies that they form. So, because they craft and recommend policies on health science, local governance, and law enforcement. So, saan tayo ngayon? Itong slide ko is what's your story? Na lagpasan na natin konti yung medical na na side nung di ba, ng COVID-19, what it is. And we need a lot of stories now on people's behavior. Anong feelings nila? Ano nangyayari sa buhay mo araw-araw? So, anong story behind the numbers? Diba? We do daily tallies, pero what's the story behind it? So, can we have the next slide? Okay, and these are the roles of journalists. For the journalists among the participants, I think you're aware of this. Now we need to. Our role is to influence policymakers. We are storytellers, but then we also have to explain and research to explain technical terms and all that. Kasi we have to present the news in such a way na people and even policymakers can understand. And whether we like it or not, we affect public opinion and perception. And then there are information that the public should know. So ang pinaka-principle ng journalism is you have this information but you don't keep it because the public should know unless you were told na hindi off the record yun or hindi pwede i-share. Okay? And we have to ensure transparency in policies, programs. Kung may magandang stories naman, worthwhile initiatives, ayan, yung community pantries, ayan, ikwento natin kasi magandang kwento yun. I mean, in a pandemic, we needed good stories, diba? So, nangyari itong community pantries. Next slide, please. Okay, for the journalists, and I think I was looking at the names kanina, marami pong communicators dito. So this applies also to the communicators. We should avoid medical jargon. Pag sinabi ng doctor na, may term siya na hindi maintindihan, paano po i-explain yun? Anong mas simple na term? We have to ask them. And then, explain technical terms. We cite examples and instances. And our role again is to clear up misconceptions and myths. And na-mention kanina yung ng dalawang speakers, we prevent panic and unfounded fear. And next slide, please. Okay, we should go beyond the trickle of monthly statistics. We ask again the experts, ano na naman ang mangyayari tomorrow. We ask about behavior, changes and trends. Ito nasabi ko kanina. And what will happen to us kung anong hinihintay nating normal? What does normal look like? So these are the questions that we should be asking people, that we should be writing about also and reporting. Next slide, please. Last na ba? Salamat po. Oo. I'm sorry po, this was not the updated presentation kasi that I gave Oo, kaya, okay. Thank you. Thank you po. Siguro mag-discuss na lang tayo.
Discuss tayo, oo. Diana, maraming salamat. Feel ko yung the monstrosity of yung issue ngayon, yung kinakaharap natin, hinaharap natin. Tsaka yung problema ng journalist na katulad mo, di ba na malaki ang responsibilidad sa komunidad. Yung entire Philippines na magpalabas ng napakaayos na report on the health, on the disease, on the effect, etc. sa time ng pandemic. Tsaka di ba, sinasabi natin lagi, hindi naman sexy beat yung health Di ba? pag kinumpare mo sa other beats, probably magbabasa or manonood depending on how you present it. As you said, sabi nga natin sa journalism parlance natin, make it more interesting para palatable sa public, pero ramdam ko yung difficulty at saka yung trabaho talaga, ang laki-laki ng trabaho ninyo. Even for most journalists covering the pandemic, in the time of the pandemic. So maraming salamat, you're na open for questions about accommodate because now's the time for the open forum. Pero shout out tayo, word of appreciation lang to Ma'am Neni. Sabi dito ni Marilyn, yung dalawang, sorry, off yung ano ko. Yung dalawang daw videos that you showed kanina during your presentation, maganda daw po yun para ipakita sa mga TV stations. Di ba? Ma'am Neni?
Yeah, isasagot ko yun. Yun ang nasa plano namin kasi nga itong proyekto namin is ang aim niya was to produce these communication materials. So iaahin ito sa DOH at sila na ang magpapamudmod, no? Hindi lang yan, no? May mga nakausap na kami sa private sector, no? Kasi alam naman natin ang private sector, meron silang mga initiatives, di ba? So ayan, kung lalabas man yan sa TV, bonus yan, pero lalabas yan kasi rin sa social media. Nga pala, gusto ko sabihin din kay Dayan, parang may dagdag lang ako kay Dayan. No, yung aming our research results show that even before, until the present time, whereas people turn to the social media to put out their expressions, and in fact they retweet itong disinformation, the fact research data shows that belief in that is very low. This is evidenced by our survey results, which indicate that people will go to the main sources, will go to legitimate sources. Pero yun nga ang conundrum. Why is it that they still click on the post button when in fact hindi rin naman sila, may duda sila. So yun nga, doon nga papasok ang ating yung mga not only etiquette, but the media literacy, this is not anymore health literacy but media literacy, diba?
Correct. Yeah, very good point. Shout out muna tayo participants from Taiwan, specifically from the National Donghua University who just greeted us in the chat room. Thanks for joining us here. Maraming salamat, and hopefully you get to invite your other colleagues in the future to join us in our training programs. Meron tayong tanong dito para puto sa inyong lahat, babasahin ko lang. Pero mayroon din akong tanong kay Ma'am Neni mamaya. Okay, with the unresolved issues on the vaccine, how can we entice people to get vaccinated more so that the COVID-19 vaccines are granted only with emergency use? EUA, di ba? Ma'am, unahin muna natin si Professor Mortel. Ma'am. Professor Mortel, are you there? Baka hindi siya online. Baka na-disconnect siya, no? Okay, Ma'am Neni, ikaw, what are your thoughts about it? Yun nga, di ba? Bakit yung mga tao kasi there's a reeling from the vaccine controversy na parang ayoko magpa-vaccinate kasi itong vaccine dati, etc. How do you, entice people to forget about it? Not, hard to forget, pero at least naman itong makitaan yung importansya ng vaccine ngayon.
Kaya alam mo, iba't iba yung mga resulta ng hindi iba't iba, pero consistent, yung magkakaiba are the questions, kasi sa totoo lang, meron rin kaming isang pagsasaliksik tungkol doon sa epekto ng Dengvaxia controversy na lumabas sa ating mga media on vaccine hesitancy or vaccine confidence. Yung sa papasok dyan ang science communication. That's why it's also important, science communication. Diane Mendoza, she is one of our best science journalists in the country. That is where the media can come in. Kasi on both sides yan yung sinasabi ni Ben Mortel na the bibingka style, luto sa ibabaw, luto sa baba. Ang luto sa ibaba could be the media. The media itself, di ba? Media pala is the apoy on the top, keeping the importance of science alive. I am a science advocate. In fact, I have had both mga informal conversations with a lot of media people. Kasi yung sinabi mo na kanina, Ariel, na parang hindi sexy ang science, parang hindi sexy ang health. Bakit siya hindi magiging sexy? Eh yun ang kalusugan mo. Mamamatay ka kung makikinig ka sa wrong information, sa misinformation. Kaya dapat kaming mga science advocates, itong mga scientifico natin at tayong mga communicators no, na may advokasya para sa science ay pakinggan ng media at mag-join with us in our in the development of programs that will bring to the grassroots an understanding of the science behind. It's contributory. Idadagdag ko na mag-aakyat ako ng sarili kong bangko, pwede kung pwede lang.
Of
course. Meron kami sa UP, hindi ko lang bangko ng sarili ko bangko itong UP. Meron kaming weekly. Kapag sinabi mo dito sa yung tungkol sa mga various issues, whether it's Dengvaxia, whether it is about vaccine hesitancy, that is affected by Dengvaxia or just the misinformation about COVID-19, we have a webinar every Friday. Every Friday. It's called Stop COVID Deaths. Ang aking partner in crime nandito sa Stop COVID Deaths nandito si Ma'am Rica, show yourself, at si Ma'am Rica is our associate producer dyan, and she is on top of that one for all this information. And at yun, napaka-information full. So Dayan, please have that covered. Kasi dyan, walang misinformation. It's scientific information which is delivered in a friendly, not in a very technical. Of course, there's technical language, pero doon namin kailangan kayo.
Yep,
yung
okay
mga
po.
journalists.
Yeah, quite a
Ano po
challenge
yan ulit?
for...
It's
It's a webinar. Stop
webinar. Okay. Yeah, okay. So they will give me the link.
Padala nyo ma'am ng link si Diana.
Ay nako, Dayan, sige. Kasi alam mo, maraming nagko-cover. Maraming nagko-cover niyaan. So, in fact, nakikita nyo sa mga balita. Ito journalism ethics na ito, Dayan, ha? Kasi nag-complain na ako, mahusay ako mag-complain sa media, ha? Sinabi ko na, very obvious na ang source of information ay ang aming webinar. Pero hindi nila sinasite yung programa. Ang sinasite nila is the person talking. Kaya nag-complain ako sa mga major news organizations, bypassing the source, The source is the program. Diba? So but at any rate, hinanakit ko na ito. PPI, call out to you.
Alam mo, same problem sa amin. Yung monthly roundtable namin, na roundtable with PPI, it's called Roundtable with PPI. It's also an online webinar. Ganun din. So, the broadcast, they cover it, etc. But, he said, she said lang, but they don't really, recognize and put that PPI and it's funder or whatever. Wala. Talagang, anyway, I hope they're listening to us right now.
Ay nako, ako madalas mag-complain. Pero but the point is, Dayan, still, the University of the Philippines, because of its mandate for public service,
true, agree,
puts this out in a kasi technical pa rin, but in a manner that curates the information, so that what information is necessary can be put out. So I think these are some of the strategies that can elevate health literacy among the media. So that's why we invite the media. So Dayan, yung link papadala namin sa iyo ngayon.
Okay, Professor Marta, are you there? Can you answer the same question? Na online na ba? Hindi yata
naka-mute.
Oo, baka hindi tayo she must be,
Ma'am Ben. Hello, Ma'am Ben.
Okay, let me just go. Andiyan na? Let me just go to Diana. Binanggit ko na kanina yung, ang daming pwedeng i-cover ngayong panahon ng pandemic. Ang daming pwedeng ilahad sa publiko in terms of access to information at saka yung karapatan nilang makaalam kung ano nangyayari. how is it for a journalist, seasoned journalist like you, covering health for so long a time? How is it difficult for you to debunk disinformation and misinformation via your articles? Kasi, di ba, ang dami-daming information disorder, pero we only get parang a little probably or some of very good stories or articles on health.
Ano pa? There are media organizations who do fact checking like Verifiles, may ganyan sila. Well, Rappler meron din. But then I work in one media company, yun ng One News Signal TV. Anniversary pa lang ngayon yung kanilang
happy anniversary.
One News Signal is the pay or subscription TV na kapatid ng TV5.
TV5, yeah.
It's a media aggregation. Maraming members dyan, Philippine Star. So anyway, I think me as an editor, and I supervise the scripting kasi of the show. I am a producer of one of the shows. Yun, doon pa lang mag-editing na, magko-correct na. So ganun ka painstaking yung process. And people don't know, I think, na yung process na yan ng pag-edit takes time. And I think kasi meron ng social media and I'm not saying we're helpless, pero I want people to sana read the pay newspaper. Kung may online sila ng Inquirer, Philippine Star, basahin nila. May online na rin yung mga TV, di ba? May online ABS-CBN, may online GMA. Basahin. Yun, kasi ito po yung na-interview, ito mga reporters na nagsulat niyan, in-interview nila yung doktor. Halimbawa, na-interview nila si Dean Pernia. Yun, kung sino yung experts, yun yung na-interview. Yung nasa social media, baka personal opinion lang nung may-ari ng Facebook account yung nakapost doon. So it's very dangerous po na may sinabi siyang ganun, may sentimento siya, naniwala ka na. Or yung vaccine ko, parang namaga yung aking braso o which is a natural effect naman ng vaccination. May fear na kaagad yung tao. So yun, magbasa po kasi yun lang ang ko talaga, defense ko, line of defense, Ariel eh. And you know that kasi nasa PPI ka. Yun eh.
Ito
legitimate ang newspaper, legitimate ang news source, ang news media.
True. Ito, meron tanong sa'yo more particular from Leo Paulo. For Diana, as a journalist, do you or your colleagues experience anxiety
while
on field? Yan, oo.
I don't go on the field na kasi po editor, lahat naman kami work from home. Effective March 16, hindi na kami nagpupunta ng studio and station. Naka-live stream na kami. But the reporters are there. Andyan sila, nag-cover sila. So, time and again, may nakakachika kaming ganyan kasi we do a story conference every day. So, ang story conference, nandun ng editors ng mga shows, nandoon yung mga producers, nandoon yung mga segment writers. Doon namin nalalaman. And the story conference it's a way of us talking to anong problema. So masaya naman, doon lumalabas yung mga pagod ng mga reporters na saan ka na naman pupunta ngayon? O ingat ka ha, yung ganon, ginaganon nila. Kasi most of the reporters are young eh. So I'm saying hindi ako young eh. So hindi ako young kasi so they're very young and they go out there in the field and they talk to people. So ganon. That's how we do it. And I think you can ask any psychiatrist or psychologist or social behavioral expert. Yun naman ang laging sinasabi ay mag-connect ka sa tao, sinong kaibigan mo, mag-chat ka, nalulungkot ka, o i-text mo siya, o kaya kausapin mo siya, do something. Ganon din po ang mga reporters. And the fact na, yun nga, may isa akong sinabi sa sarili ko minsan na ayoko mag-interview ngayon kasi ayoko umiyak. So marami mga reporters nagsasabi niyan. Nakakapagod na pong umiyak eh. So, pwede bang naman? So, ganon, nag-alternate sila. Kasi, di ba, they interview people na namatay, naka-ash na lang yung tatay niya, hindi man lang niya nakita. Ang bigat nun, tapos mapapanaginipan mo at night, di sila makatulog. Ganon ang effect ng nag-interview ka ng isang namatay tatay niya. Kanina, okay yung tatay niya, ngayon patay na siya. So, ang hirap i-process yung emotions.
So, ayan.
So, yun, it's same as ordinary people. Ganon din. Yun, yung manulungkot si Ariel, tatawagan ako ni Ariel, chikahan, chismisan.
Di ba?
That's it. You do that. Every one of us.
Oo. Kayong nagbabalak na magkaroon ng trabaho, ng profesyon sa industriya na ginagalawan namin ngayon. So, a lesson or two from us or from Diana, na hindi lang in the time of the pandemic, kahit ipadala ka sa isang conflict-stricken area, nag-cover ka ng Marawi. Dapat meron kang debriefing. Di ba sinasabi natin, what help do you get from your news organization? Kasi tulong yan eh. Tutulungan mo yung sarili mo, tutulungan ka ng management po, tutulungan ka ng pamilya, tutulungan ka ng mga tao na nakapaligid sa'yo. Just like any normal human being talaga, you get, seek help talaga, professional help kung meron kang anxiety.
And
Okay.
during the start nung lockdown, nag-umpisa na kami mag-live stream. So lahat ng TV ganyan, wala nagpupunta sa mga station. So may naka-duty na, kailangan mag-duty yung mga technical, di ba? Kasi sa television technical and production. Naka-lock in sila. Marami nagpa-positive from time to time. So nakailang shutdown na yung TV5. Nangyari din yan sa, I think, GMA or CNN. Nag-shutdown sila kasi ang dami nagpa-positive. And that's our situation right now. So hindi lang physically tinatamaan ang mga media, pati emotionally. So kung may kaibigan kayo sa media, kumustahin ninyo siya. Do you see Ariel, Laili Pareño, namatay siya sa loob ng kotse niya. Kasi,
yes!
Yeah, okay. He was a
so
journalist
shocking.
of ABS-CBN.
Yeah, so
and then
shocking.
sinabi lang niya sa friend niya, pare may COVID pala ako. Yun lang yung text niya. Hindi alam nung friend niya na nasa kotse pala siya all that time. Doon na siya kumakain kasi natatakot siyang lumabas. And he died. I'm sorry to cite that.
Yeah.
Okay, Ariel, sige.
One
Thank
case
you.
done, Thank you. We'll get back to you later on. Meron tayong tanong for Dr. Pernia. It's kind of related to the other question a while ago from Miss Tess of DCUP. Dr. Pernia, paano po natin mahihikayat ang mga tao kung may mga issues po ang mga bakuna gaya po ng AstraZeneca?
Yeah. Related yan. Hi, Tess. Okay, kamusta na? Pero related rin yan dun sa question ni Marilyn Lim because they are related, no? Ito, yung tanong ni yung tanong ni Tess relates to how can you influence people to take the vaccination when they hear about issues regarding AstraZeneca. Yung kay Marilyn Lim naman is what about those who have those who have comorbidities. Ang importante dyan is you use a good source, and a good source is a doctor, and we have so many public health doctors. Ben Mortel will probably be able to list down for you sino ang mga media-friendly public health doctors at pagkikita natin sila sa media rin all the time na pare-pareho ang sinasabi nila, no? Pare-pareho ang sinasabi nila. There are the only type of yung allergy that should stop a person from getting vaccinated is an allergy to previous vaccination. All other allergies are fine. Wala kang they should not be hindrances, no, to getting vaccinated. Regarding the AstraZeneca, I think there is now new information, diba? That AstraZeneca is okay for all for most age groups and situations. But let us hear it from our health expert, Dr. Beng.
Dr. Beng, are you there? Ayan na, she's back. Hi, ma'am. Ayun.
Hi, magandang hapon. Ano po ang aking maaring tugunan?
Ito po yung meron pong sinagot si Ma'am Pernia on one, yung kay Marilyn about yung comorbidity, etc. Tsaka kanina pa earlier, we were talking about how do you entice the public to really go out there and get vaccinated amidst the controversy on them vaccine that actually prevented them, still preventing them to really avail of the vaccine kasi nga may takot, merong etc. So anong maging role ng public health natin or in terms of health promotion?
Okay. Damang-dama ko po yan yung tungkol sa Dengvaxia. And during that time, I was working with one particular region and help them go through the painful experience of really responding to their different target audiences. And especially by giving enough information, but before that, asking how they felt at the moment. I think that was the first step that we did, to ask them how they felt at the moment and also give them the more scientific information later on. Now, with regard to the effect of it, actually, it now becomes multifactorial. Yes, on the one hand, there's Dengbaksha issue lurking at the heads of people kasi yun yung masyadong nabigyan ng pansin, I'd say, even to the point of really highlighting too much of the effects. But of course, there are certain things from a health perspective which I would not discuss at this time. But with regard to the vaccine hesitancy of people right now, we see that there are a lot of information coming in. And what we continually say to people is that when spokespersons give the information, to give the complete information. Kung meron siyang side effects na ganito, sabihin talaga na meron ganitong side effects because that is the nature of vaccines and other drugs. Meron talagang possible side effects at naayon yun sa mga bang. And after giving these side effects, to balance the information, what the benefits of having the vaccination? Because towards the end, the benefits still outweigh the costs. I think that's the bottom line. But how do you tell that to people? Pero ang sa akin, wag itago yung possible side effects kasi meron yung iba. Hindi sa lahat ng tao pwedeng mangyari, pero maaaring mangyari sa ilang mga tao, lalo na yung mga sensitibo. You see, to be open about it, and also for important leaders and celebrities to really lead the way as our models na, oops, nabakunahan na ako. Kung ako nabakunahan, ikaw rin pwede nang magpabakuna.
Correct.
So
there's nothing to be afraid of, ano? Professor Mortel, ano? The vaccines are safe no matter the brand. So it's just, the right knowledge before you get vaccinated. Tsaka, once in a while, you promote it naman din para you entice other people to join you or to get vaccinated as well. Like I did when I got mine kasi meron ako comorbidity. So I went to my barangay health area and then they wanted me also to promote it in my neighborhood. So I did. So yung mga ganong So we have a stake talaga, no? Yun.
Siguro idadagdag ko lang po because the side effects have already been identified for some, at least based on the studies that have been done. Now, professional societies, professional medical societies have already come up with protocols on how to respond to it. Kaya nang sa ganon, kung allergy yan, meron na rin ginawa ang Professional Society ng Allergology para alam ang gagawin. Kapag naramdaman mo to, ano pa ang saan ako dapat pumunta. So it's really a matter of just accessing the information also.
Professor, kailangan talaga natin itanong to para marinig talaga ng iba. Kasi here's a question from I just said about how safe it is, etc. Hello po. At sabi niya, ask ko lang po, safe po ba magpa-vaccine? Anong age po pwede magpa-vaccine po? Required po ba sa lahat magpa-vaccine? Thank you po. Ayun, sige Professor Mortel. Sabihin na natin.
Actually, naaayon po yan, yung mga bakunang ibiniga nasa ating mga vaccination centers ay naaayon din sa mga kanilang edad. So, meron pong nagsasabi na itong vaccine na to pang age group na ganito. Merong vaccine para sa senior citizen. Meron naman. But I know that there is information about specific age groups and also kung may mga comorbidities ka, meron silang recommendation. Kaya nga, pag nagkaroon po ng survey, sinasabi na, i-declare nyo po kung ano yung mga comorbidities nyo. So, para mabigyan kayo ng nararapat na impormasyon, kailangan din po tayo, i-declare din natin anong ba ang ating mga comorbidities o ilang mga karamdaman o history ng karamdaman para mas alam ng mga health workers kung ano ang babagay po sa atin.
Yan. Importante po. Dumulog po sila, pumunta po sila sa barangay nila po, Professor Mertel, para malaman ko ano mga requirements kasi which I did also. Tapos nag-sign up ako, nag-register ako hinintay ko yung text nila, etc. etc. But I think ang nagtanong nito talagang estudyante. Interesado siya kung pwede siya or kailangan ba niya magpa-vaccinate talaga. So,
Pwedeng mag-bat-in, pwedeng mag-bat.
Yes,
Yung mga tanong na gano'n, no, dapat talaga doktor ang sumasagot para sa atin, no. Pero meron na nga ang sinabi na ni Professor Mortel, meron ng mga nasulat ang mga medical associations, particularly ang PISMID, no, na meron na silang parang in fact it is what do you call that, it is it's kind of laymanized na, madaling maintindihan na. Doon papasok ang mga journalist kasi alam nyo, so umiikot yun sa social media, no, pero delikado ko minsan sa social media kaya please, Diane, please all journalists, pick up those materials from the professional media, medical associations, and they're the ones that can become happy stories. Information, no, na diretsong pupunta at yun ang kailangan ng mga tao. Mga tanong ng safe ba ako magpa-vaccine? May problema ba? I am 49 years old. May problema ba ang AstraZeneca kung yun ang kunin ko? Yung mga so meron na kasi ang media medical associations. So nandun na siya. So ang kailangan lang gawin ng mga journalists is to again assist in its dissemination.
Try to storify, get them storified para merong narrative on that. Oh, yeah, quite a challenge for us. You want to respond to that, Diana?
May halimbawa, may isa kaming Sunday. Yung show po namin na The Chiefs kasi may Monday to Friday lang. May isang Sunday nag-special kami kasi ang daming tanong. So ang guest namin is Dr. Nina Gloriani of UP Manila, tsaka si Dr. Kong Kikison. Dalawa sila and another doctor. Puro doktor yun. Yan, ginawa naming interactive. Alam niyo yung parang ganito, may magtatanong sa online, sasagutin ng doktor. Kasi we needed to do that on a Sunday. Pinatrabaho nila kami ng Sunday para sa bayan. Para lang masagot ng mga doktor yung mga ganyang mga tanong lang, yung mga simpleng, yun po bang bata pwede nang mag-vaccine? Yung mga ganon. Yung mga ganyang. We do that. And sa mga stories, syempre.
May ganyan kami doon sa aming webinar, 2 beses na talagang Q&A na, no? Isang tanong. Kasi yung mga sagot, yung mga tanong na nasa utak ng mga tao na for some reason hindi naguguluhan pa sila despite information that we think have been put out already. Kasi itatanong palagi yan. Ang storya hindi pa tapos.
Hindi pa tapos. Exactly.
We don't even know how this will end
Exactly. Tsaka yung binabanggit na ano ba yung magiging normal? Hindi na siya normal by that time. Mag-iiba na yung landscape. Binanggitan natin yung kaguluhan, confusion in this time of the pandemic in terms of information blah. Here's a very good point from Sir JB kasi binabanggit natin na kailangan natin sa credible source of information ang mga taong dapat natin pakinggan. Pero he came, itong isang politician natin, itago natin sa pangalan Mike Defensor, na get to model everything na promote pa yung ivermectin na hindi naman siya talagang at that time, sending a message across na hindi naman siya pinopromote ng DOH, di ba? So how do we call out people like those?
Ako ba? Unahin ko na yung sa media. Sa media kasi doon pa rin kami sa authority. Sino ang nagsabi ba na hindi pwede mo nang i-address ibigay sa tao yung ivermectin? It's the Food and Drug Administration. Yun at yun ang kinukot namin, Dr. Eric Domingo of the Food and Drug Administration is saying, hindi po pwede muna sa tao. So doon tayo. Kasi hindi rin kami mga doktor So yun ang ikukot namin. Meron pa rin mga tanong, meron pa rin doktor, may iba rin doktor actually kasi na nag-promote nun So and then here comes 2 politicians distributing ivermectin. So nagulat ang media doon. So balik ulit kami kay doktor. Ganun kami lagi, balik sa expert kasi an expert is someone who should know what he's talking about, di ba? So balik tayo kay FDA, which is under DOH, di ba? So ganun, sasabihin na naman niya, kailangan pa kasi ng clinical trials para makita natin kung ma-address niya yung mga illness ng tao. But it's ivermectin is for animals. Di ba? Ang pinaka-basic
right,
ng i-address.
right, true.
So yun, ganun ang ginagawa ng media po. Babalik at babalik sa doktor, sa kung sinong eksperto, sinong specialized na discipline, na sila yung mag-explain po. Hindi po yung politician ang ano.
Yeah. Chari Lau was saying, tama ka, Chari, awareness po is always a good thing. Correct. I agree, absolutely. Okay, will the presenters be willing to share the presentations with us? I think so. Yeah. Kat, Lisa, I think they're too willing to share the presentation. And also our presenters willing to share to the organizers their presentations or lecture materials. Can you please discuss more about the role of the local governments in health literacy in the local level? Should we put more emphasis in the role in this responsibility? Would you say that there is sufficient effort to cascade health information from central government, meaning from DOH going down to the barangay level? Meron other efforts or sakto ba yung efforts or kulang yung efforts? Who wants to answer this first? Professor Mortel? Nakasmile na po kayo. You're so ready to answer the question. Yes, please.
Well, I believe that it's really local government that would create a dent in cascading the information, because they would also have the ability to customize the information according to the particular characteristics of their province or their city, or particular misconceptions of one barangay or one municipality. And what I observed is that those local government chief executives who are really serious in responding to COVID-19 provides the open communication to his constituents and also provides the necessary training for his people around to develop messages that are appropriate for people. Inaalam nila kung bakit ba may mga kaba pa yung mga tao, bakit pa may inis o ano pang kailangan para sundin nila yung protocol. Kasi ang naging concern sa isang municipality, bakit ang haba pa ng quarantine, magkakamag-anak naman kami. Something like that. But they had to respond to it and explain the kind of protocol needed to protect not just one family, but the whole municipality. And going back, it's really the local government who has that ability to customize it to have more appropriate at kailangang kanilang, how do I say it, to really be part of the solution, not only the central government.
Agree. I so agree.
May I add?
Yes.
I add? Well, yes, I agree with Professor Beng, but I am a believer in private-public partnerships. No, it is it is the LGUs. Whether it is at a barangay or a municipal, a city, a province, or regional level, I agree. But then, when it comes also to making a dent, to making an impact, nothing beats a participation of the civic and the private
sectors. Yeah. Perfect. Ma'am, before we go,
and especially now, that we have been having bayanihan. You know how alive bayanihan is?
Yeah, I was about to ask about what your thoughts on the community pantries before we go to the last question from Ruby. Ma'am Neni, your thoughts on the community pantries?
What do you mean, my thoughts on the community pantries?
Because I did have thoughts about yung presentation mo on compassion, etc., your values of etc. So part of that, and I also mentioned about resiliency. What are a little about the phenomenon in the community pantry?
Well, it really shows empathy, di ba? You can see now, di ba, what people are talking about. This is not just talk about it. This is action about it. But I really do want to say also that there should be the health protocols that are followed. I am very, very happy that again there is participation now. See the private partner participation. Pag may meron ng maybe not in all community pantries, but I know the ones that are around here in my area, where I live in Quezon City, where I think that the Quezon City government has embraced, our community pantries as a response, of individuals to the needs of others.
Yeah.
And then meron nga doon mga reminders about observing health protocols. So again, this is bayanihan in its beautiful sense, and should be as much as possible implemented, following health
protocols. I agree perfectly. Okay, here's a last question from Ruby Rowan Cristobal. Could there be other reasons as well, apart from false information, like belief systems that are reinforced by such wrong information? If so, then maybe we need to tailor our messages to different diverse audiences in order to better explain the advantages of vaccines and other health interventions.
Yes. But of course, Dr. Cristobal is a science communicator at the DOST, and she knows whereof she speaks. No? So yes, Dr. Cristobal, please, assist us in assist the country, in doing this.
Yeah, perfect. Okay. Final words from Professor Mortel. What is your message to the public right now? Amid this raging pandemic, people wanting to get vaccinated and choosing what kind of vaccine, but also there are other people really having reservations. Wala si Professor Mortel because she's also attending to another webinar. There you are. Sorry, final words na to, Professor Mortel. Yes.
Okay. I think we have discussed a lot already about the framework as well as experiences here. As a public health person, I would just like to call on people to really appraise the kind of information that they have and to go to very credible sources of information, and also as well as try to see how we can protect ourselves and family. I think it's really weighing what would be best for all of us, and that's part of health literacy, to get that information. Sa akin po, bilang isang tao sa public health, alamin po natin lahat ito at tingnan natin kung anong bakunang nararapat at makipag-ugnayan tayo sa ating mga vaccination centers.
Maraming salamat, Professor Mortel, for joining us. And last but not least, some words of wisdom from our colleague in the industry, Diana Mendoza. Hi. Last na.
Mag-word of wisdom.
Oo, siyempre. Meron mga aspiring journalists dito.
Yun ang sasabihin ko. Yun na lang ang aking words of wisdom sa mga aspiring journalists. Okay, iba yung yung generation ninyo ngayon ay iba ang media, ang daming platforms, multiple platforms. So, ang kailangan lang is you go traditional, ganun pa rin, yung the way we were brought up in the industry. Magbasa, you have to have a lot of reading to do. Kahit siguro hindi health ang bit mo, kahit i-cover mo yung presidente, yung mga legislators, yung ganun. You need to read, you need to know everything. Di ba ang journalist sabi nga nila, you should be a jack of all trades. So, pag-aralan mo lahat-lahat anong nangyayari sa paligid mo. You should learn how to be analytical. You should know what's wrong and right. And in the first place, kasi kailangan mong i-share yan sa tao eh. And please bear in mind that you have an audience, the public. So you have an information, you process that information, you package it in such a way that the public will be able to understand, and you can influence their decisions. So ganun lang. So communicators, believe ako sa inyo kasi kailangan nyo rin, di ba ang mga roles ng communicators kay government or private, ang laki din ng role nila, and ikino-connect sila sa media. Sila yung una ding hinahabol ng media, di ba? Yung mga communicators. So yun lang po. Salamat po.
Agree. What you do with information is called journalism, di ba? Di ba? Again, yung lagi namin sinasabi sa mga webinars natin na pakinggan yung legitimate source of information kasi that's the only way to to really battle it out with this information disorder. Tsaka importante, again, we could emphasize more the importance of really listening to the experts at saka mga tao may credibility, may authority to say a lot of things, especially about the pandemic. Okay? Maraming salamat to our panelists, to Dr. Nelly Pernia, to Professor Mortel, to Diana Mendoza. At this point, we now go to the synthesis of all our discussions. To provide us is my good friend, who is a retired professor at the Communication Research Department, College of Mass Communication, the University of the Philippines. She is also Executive Director of the Philippine Social Science Council and Head Researcher Writer for TVUP University of the Philippines Television, and also an adjunct faculty member of the UP Open University. Please welcome my good friend, Dr. Lourdes Odette Portes. Hi.
Hello.
Dr. Ode, how are you?
Hi, nako. Naka-work from home sana, pero dahil dito pumunta ako. Dito dahil maganda yung internet connection. But anyway, are we running out of time? So I will dispense off with the individual greetings. Andiyan naman lahat ang mga mahal natin sa buhay. Hello everybody. Good afternoon. So don't you think that this is such a rich webinar, no? That we can mine, di ba? But in the interest of time, I will attempt just to give you snippets, and please bear with me if I miss some of the details. So, we of course had encouraging and forward-looking preliminaries from Dr. Santiago, VP Bailon, and Chair Popoy de Vera. Arvinda Santiago recalled to us the beginnings of COVID-19 in the Philippines and how we have been responding to it and why this webinar is very important. VP Bailon narrated to us his personal experience having been a victim of COVID-19 as he expressed excitement in hearing from the experts some context on the existence of COVID-19. Siyempre, our ears caught his statement that he will continue to support activities like this. Hindi ko sinabing webinar, activities like this. So pwedeng iba pa, research, training, and other activities. So, VP Bailon, narinig po namin yan. Okay? Now, what better way to start the presentations than to have a framework that would establish or provide the scaffold to this webinar? Well, Dr. Pernia did just that. Using the conceptual basis for health literacy framework, she reminded us that literacy equals knowledge plus power. So she traced the history and development of the concept of literacy from a very restrictive technology, later with book production, then on to UNESCO's enabling people for full civic engagement, then its functional recognition in preparing men and women for a social, civic, and economic role beyond the 3 R's, the reading, writing, and arithmetic or numeracy. So Dr. Pernia narrated that the multi-dimensions of literacy give health, including human rights. That includes human rights. So she also, having clearly presented to us the concept of literacy, on her own, Dr. Pernia has developed a framework for promoting ICT literacy, which featured proficiencies or dimensions such as knowledge dimension, skills dimension, and critical assessment dimension. In the area of health, she said that there are 3 major dimensions of health literacy. 1, pertaining to health knowledge. 2, to skills relevant to using health knowledge, such as the information technologies. And the 3rd, to attitudes accruing from critical reflection of one's health practices and behaviors. Dr. Pernia's presentation then moved to a competency-based health literacy framework, which was shown before us and describing the major dimensions of health literacy: knowledge, skills, and attitudes. And these are related to key competencies for foundational knowledge, technical skills, critical assessment skills. Then moving from the theoretical framework, Dr. Pernia segued to the operational framework or application as she asked, what can we say about the health literacy of Filipinos when the COVID-19 public health crisis began? And she presented pictures of her discoveries and concerns, that there is a volatile mindset among the participants as they shifted in perception, and there are mixed emotions of anxiety, anger, empathy, triggered by the ECQ. The pandemic further magnified the inequality and disparity in concerns regarding the outbreak, as well as responses between the upper class and the masses. So this is one of the findings of her research. What about their level of knowledge? She showed the graphs and the context of media trust. There was lack of trust on social media because of fake news. So she discussed the framework to build COVID-19 health literacy, which consists of media access, messages, and context. She explicitly presented what COVID-19 literacy is and how it is measured following the dimensions of health literacy, which consist foundational knowledge like cognitions and level of awareness and comprehension about COVID-19. Technical skills, which include practicing and advocating healthy choices regarding the prevention of COVID-19 transmission. And lastly, critical assessment, which means evaluating COVID-19 information for credibility and quality. Sharing more findings in her team's just concluded research on COVID-19 communication, she found out that generally respondents claim to be more knowledgeable on COVID-19, its transmission and prevention, but they had low knowledge on the COVID-19 vaccines. It was interesting to know the trends of COVID-19 and see the high sentiments on the conversations in social media, which revealed fear, anxiety, and panic as dominant emotions triggered by issues on the availability of the vaccines, opening of classes, and the critical trials being done. Other sentiments, like anger, hate, boredom, hopefulness, and optimism, which was very low, call for the nations were noted to have increased as conversations about the vaccines progress. So, what do we have? We now look forward to the timely study of Dr. Pernia, and if we get hold of this, then we will reach a higher level of literacy from the stories told about COVID-19. So abangan po natin yung mga videos na yan. In fact, merong akong nakitang isang comment na dapat nasa TV yan. No? Pero nasagot siya ni Ma'am Pernia na, this is with DOH who should be disseminating all of these productions. The next presenter, Professor Buenalyn Ramos Mortel, discussed health promotion amid COVID-19 and complemented Dr. Pernia's presentation with her insights, further clarification, and the Bibingka approach, which actually explained health literacy, which is defined as increasing knowledge and social skills to help people make the healthiest choices and decisions for their families and themselves, using the three pillars of good governance, healthy cities, and health literacy. Okay, resonating with VP Pernia's talk, literacy equals knowledge plus empowerment, and in promoting health, according to Professor Mortel, we are empowering people to gain control over the situation, which includes controlling the risk of contamination, ways to protect oneself and others, and to cope in living in confinement. So empowering means managing the situation and delivering the appropriate message to our public. But there is a caveat. She cautioned us that there should be a balance between empowerment and making people feel excessively confident about it and forget all about the health protocols. So she concluded that health behavior will still be the most powerful treatment for COVID. Prof. Mortel emphasized that health literacy is a health promotion approach that enables people and communities to acquire, understand, appraise, and apply the best available knowledge and skills to cope with health threats such as COVID-19 and empower them to apply these actions in the context of their everyday lives, values, and ambitions. Having health literacy means making sense of the situation, controlling the risk of infection, handling the deluge of health information from different sources, and how to integrate these volumes of information into personal behaviors. In conclusion, the speaker urged us to reflect on the pandemic itself, how the individual defines his or her role in it, and she suggests that we provide information to those who really need it. Okay, moving on to Diane Mendoza. She showed us what health reporting or health journalism is by initially recalling how the virus started and providing us statistics in both local and international scenarios. She mentioned her sources of information and presented few samples of their websites, such as the medical journal Lancet, UP Medical Journal, the HAIN, no, which was headed by Chancellor Tan before. And she also asked the question, how are journalists meeting this challenge? And she related that they were really unprepared, shifting to a new terrain that was, difficult to do. And she described the Journalism 101 no, in the newsroom, no, where there are sections and they are given items to cover. So health reporting is a big responsibility, according to her, and that journalists should be able to understand what they should tell the public. They should know what variants mean, what airborne means, what droplet means, what genome sequencing means, and what social distancing is. She explained that COVID-19, being new and emerging disease, remains unverified and is ever-changing, keeping experts struggling to present their findings to the public and to the world. But she observed that the focus is more on breaking news and not more on analytical and in-depth coverage. She therefore drove home the point of doing research and urged journalists to study the phenomenon, conduct research so that they may be able to explain what SARS-CoV is, what RT-PCR is, what is contact tracing, what is a variant, and what is genome sequencing. So, he also said that there are many platforms that journalists are faced with, but the challenge is to really use the traditional media, because he said that these are still reliable. No? Even those that are in the social media, they can take a look at the online versions, let's say, of Inquirer and the Philippine Star. So Ms. Mendoza then proceeded to give us interesting scenes behind the headlines, no? And how journalists must cope with too short attention span of readers, the lack of research, the scoop mentality, and that feeling tired, no, and really sounding of crisis and emergency when they are really exhausted. So our speaker urged journalists to tell their story by asking people about their experiences, to tell their stories truthfully and honestly, as about their feelings, their daily life, and the story behind the statistics. So, in conclusion, no, the resource speaker said that we should rally support for worthwhile initiatives and come up with more suggestions for journalists, such as avoiding medical jargon, explaining technical terms, citing examples and instances, clearing up myth and misconceptions, and make information accessible so that we can prevent panic and unfounded fear. So she suggested that we go beyond the trickle of monthly statistics, ask experts for further triggers of a surge or a wave, ask about behavior changes and trends, and open discussions of a normal post-pandemic situation. Now, going to the open forum, the open forum was almost like a lecture because we got a lot of information to supplement the resource speakers. So these are my takes on the open forum. Number one, regarding the unresolved issues on the Vaksha, we need science communicators and science advocates. And we should always bear in mind the importance of science and keep it alive. No? For media, they should join in making people understand and maybe take a look at all the works of these scientists and help disseminate this to the people. Okay? For media, they should also cover scientific information and call out people who are not really in the medical profession and who really provide information that are based on opinions or other sources. Okay. Now, regarding the how do you debunk the information? Again, no, the answer was fact checking. No, you go to fact checking organizations, and Miss Diane mentioned that there's really a need to read, and go to legitimate sources. Okay. Do you experience anxiety? That was one of the questions. I think everyone else experiences this, and so they should connect to psychologists, and they can show their emotions, they can show their heavy feelings, but they should be like ordinary people trying to live and trying to struggle. And as long as they have the assistance from psychologists, psychiatrists, and friends, then they will be good. Okay, regarding the issue on the AstraZeneca, I think that was answered by Dr. Perniel, and say that, we should really get it from reliable sources. And who are these? The doctors, the public health doctors, and all of those who can be relied on in giving accurate information. I think that is other questions. Nasagot naman yung tungkol sa ivermectin. No? Again, no? It's really pointing to the fact that we need scientific information regarding this. Since it is still on trial, then we should not rely on politicians to be giving us information about this. Okay? Regarding the community pantries, Dr. Perna said that these are showcases of empathy. At ito yung sinasabi niyang public-private partnership, no, which is being kept alive by these community pantries.
Or bayanihan.
Yeah, or the bayanihan. I think that's about it. Other takeaways? Okay, yung final words from Beng. You appraise the kind of information and get it from authorities. Now, from Dayan, for aspiring journalists, you have different platforms. No? But again, we still suggest the use of traditional media and to keep on reading so that we will all become health literate people. Thank you very much.
What a way to wrap up our discussions. Thanks very much, Dr. Portes. To officially close our program is the current dean and Center Director of the College of Public Health, University of the Philippines, Manila. In the past, he has served as the Vice Chancellor for Research and Executive Director of the National Institutes of Health, University of the Philippines, UPM, NIH, and is currently Professor and University Scientist 3. He is also an adjunct professor of Global Health, University of Pittsburgh School of Medicine. Dr. Belisario is a medical doctor with a training and expertise in tropical medicine and public health. He served briefly as regional focal point for neglected tropical diseases in the World Health Organization, Western Pacific Regional Office. He has also served as advisor in regional international health affairs. He was a member of the Research Strengthening Group, RSG, of the UNICEF/UNDP/World Bank/WHO Special Program for Research and Training in Tropical Disease, and later a member of the Scientific Technical Advisory Committee of WHO TDR. He currently serves in the Soil-Transmitted Helminthiasis Advisory Committee, Task Force for Global Health, USA, as member, and the Forum for Ethics Review Committees in Asia and Western Pacific as Vice Chair and Country Representative. Please welcome Dr. Vicente Y. Belisario, MD, MTM, and H. Dean of the College of Public Health of the Philippines, Manila. A video message from him, please.
Dr. J. Prospero de Vera, the third Chair, Commission on Higher Education. Dr. Arminda Santiago, Dean of the UP College of Mass Communication, also President of the UP College of Mass Communication Foundation, Incorporated. Ms. Risa Silvestre, Executive Director of UP College of Mass Communication Foundation, Incorporated. Mr. Ariel Sabilino, Executive Director of the Philippine Press Institute. Mr. Jose Bayani Bailon, Vice President, Corporate Communication, Nickel Asia Corporation. Dr. Lourdes Portus, Executive Director, Philippine Social Science Council. Our distinguished speakers, Dr. Elena Pernia, Ms. Diana Mendoza, and Professor Beng Ramos Mortel. Honored guests, ladies and gentlemen, On behalf of the University of the Philippines College of Public Health, also designated as the SimioTropMed Regional Center for Public Health, otherwise known as TropMed Philippines, I wish to thank you all for allowing us to be part of this very timely and relevant webinar on media and information literacy with the theme Health Information Literacy 2021. I commend the UP College of Mass Communication Foundation, the Philippine Press Institute, and the Philippine Social Science Center in organizing this forum that addresses health literacy, especially in the time of pandemic. The era of health myths and fake news continues. I call these negative vibes, possibly even poison, that pose a threat to successful control and prevention of major public health threats, including this pandemic we're in, high-impact diseases, all major threats to human health, life, and productivity. We have not even won our battle with long-standing diseases, tuberculosis, vaccine-preventable diseases, infectious diseases of poverty, malnutrition, as well as the emerging ones that include non-communicable and lifestyle-related diseases, hypertension, diabetes, heart and lung diseases. And last year, you have COVID-19 pandemic coming into the picture. There is so much to do in public health, and responsive as well as responsible communications will be one of the major keys in declaring victory over each one of these. I am certain that health workers, journalists, friends in media, and educators attending this event have all benefited from the presentations. Dr. Elena Pernia, our UP Vice President for Public Affairs and former Dean of the College of Mass Communication, where she shared highlights of their research on communication during the time of COVID-19, people's perception, health myths and disinformation about COVID and how these affected health behavior, how people access information, and how people process information, which are all much appreciated. In a similar manner, we value Ms. Diana Mendoza's presentation on health reporting in time of pandemic that proposed approaches that journalists could take to help our audience make better sense of available information. We applaud our colleague from the UP College of Public Health, TropMed Philippines, Professor Beng Mortel, for putting into context health literacy as one of the pillars of health promotion, one of the key disciplines in public health that helps us respond to the challenge posed by the pandemic and the United Nations Sustainable Development Goals, many of them health-related, that we all must help address. To close, just some reflections. We need to cite key health information from the right sources. Our health authorities are experts at the global and national levels. In the Philippines, possibly even our regional and local health authorities. At the community front, we need to understand what people think and feel about the pandemic and other major public health concerns. We need to periodically assess what people are currently thinking and feeling as perceptions change depending on the information provided amidst the changing situation in the communities. On public health and mass communication, we must work together even more closely in these very trying times. We realize how public health and media can be effective partners in a duet, perhaps, in delivering accurate, timely, and relevant key health messages to the public, providing guidance for response and action. We recognize how public health can view health messaging from the standpoint of media and how media can appreciate the nuances of health and matters from the standpoint of public health, where we deal with so many people in the communities. Finally, we emphasize that public health can work together with media advocacy groups for health that seek to influence not just health behaviors, but also the environments that enable these behaviors. There is much to be done in this area now and in the coming days. Let me make a strong call, therefore, for more collaboration with mass communication and media more than ever. That is public health and mass communication. I look forward to follow-up conversations with key people in the UP College of Mass Communication, the Foundation, and with the groups represented in this forum to explore collaborative work in the areas of teaching, training, research, generation of new knowledge, public service, along with public information, possibly in joint projects and programs. I am very serious about this, and I look forward to a follow-up meeting with some of you sometime soon. Do tell us the date, time and place, and we from the College of Public Health, TROPMed Philippines, will be sure to be there. Thank you all for this very successful webinar. Isang mapagpalang hapon po sa ating lahat.
Thank you so much, Dr. Pelizar. What a way to really end our program today. Very significant discourse on health and information literacy. One final remember for everyone, if you want to get your certificates, please respond to the survey or to the evaluation form. Please answer the evaluation form. Maraming salamat ulit. Thanks to our panelists, to our resource persons, and also to our participants, both in the meeting room and also watching us live via Facebook, all the way from Taiwan and other places in the Philippines. Thanks very much. This webinar was organized by the UPCMCF Foundation Incorporated in partnership with the Philippine Press Institute and the Philippine Social Science Council in cooperation or collaboration with the University of the Philippines Diliman System, the University of the Philippines College of Mass Communication, University of the Philippines College of Public Health, and the Commission on Higher Education, of course, supported by Nickel Asia Corporation. Be well, keep safe, and be health information literate. Maraming salamat po ulit, and we'll see you next time. As promised always. Thanks very much. Ayun, salamat. Sa ating training team, of course, sila Kier, sila Kat, of course, our secretaries, Risa, and the team, the whole team. Maraming salamat po sa inyong lahat. Ayun. Yehey.
Thank you. Thank you very much.
Thank you so much, Ariel. Din Army, maraming salamat.
Maraming salamat sa inyong lahat.
Salamat po.